All right, ladies and gentlemen, if we could ask you all to please take your places and ask that the chambers please quiet itself, and ask the members of the Board of Supervisors to please find their seats at the dais. Thank you. And I believe we've been advised that Supervisor Wasserman will be somewhat delayed in joining us this afternoon, but we do expect him a little later in the day. And we're going to begin by reconvening this recess session from yesterday, and we'll start with the roll call to once again establish the presence of a quorum.
Supervisor Wasserman, Supervisor Cortese, Supervisor Yeager, Vice President Chavez, and President Simidian.
Here.
We have a quorum.
Thank you. The presence of a quorum having been established, we're going to ask that we all now stand for the Pledge of Allegiance to the flag, which will be led by Supervisor Yeager today.
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all very much. That brings us to public comment. Public comment is that portion of our agenda for comment on non-agendized items properly within the jurisdiction of the board. We do have one card from Scott Largent. Mr. Largent, if you'd like to step up. As you know, we have 3 minutes set aside. Is Mr. Largent out in the hall? We could welcome him, and I see that our clerk is bringing me more cards, so if you'll bring those forward, we'll call those nice folks up as well. We have 1, 2, 3, 4, 5, 6, 7 cards now from one member who was one member of the public. We now have 7, and pursuant to our rules, and I just want to confirm this with our county council, I believe that means we allow 2 minutes for public comment when we have that many speakers. So, Mr. Largent, if you'd like to come forward, you will still be first up, and you will be followed by Laura Wright, Audrey Calderon, Victoria Kirshner, and Sammy Abdissa.
Sorry about that. I wasn't as prepared. I was out yapping in the hallway, you know.
All good.
Out there talking with people. Good afternoon, Scott Largent. You know, sometimes I forget what I'm going to talk about up here, and today I guess I'll talk a little bit more about the visitation to see my daughter. So on the 29th, Kalia turns 3. And I am really keeping my fingers crossed. I always get disappointed with this stuff because it never, you guys know it doesn't pan out. So this Choices for Children, this was a bomb about 2 weeks ago. This one didn't pan out at all. I paid about $100 for the intake stuff. That was just a joke. This other one right here is Kids First, and they're over off of Coleman. Now I've gone in, I've done the intake appointment, I paid the money that I'm struggling financially right now. I've been paying $100 an hour to see my kid. You have to do the intake appointment, so I have to pay $50 for myself, then I have to pay for my ex's $50, and then I have to give them the prepayment for the $100 an hour. So think about that. If I have 4 hours a week, you know, do the math. This is a very expensive thing to go through. I should have been doing this 2 years ago if the county would have enforced my rights as a father. If they would have enforced the visitation, and I'm not saying arrest my ex, they could have told her, look, you're breaking the law, he has visitation, you know, give him his visitation. So this is not going to work out. I'm getting used to this never panning out. So I have a lot of folders like this, a lot of disappointments, and how many other fathers are in my situation, or mothers in my situation. I just don't know what to say. Somebody do something. Somebody do something. You guys have power. You can make telephone calls. You can call down there to Patricia Lucas or to the court and say, or even Garcia, or even, you know, maybe even talk to Lori Smith. She's been stepping up to the plate lately for the community that's fighting for their children. So why don't any of you do anything? Isn't this really annoying that I'm coming in here all the time? I just want the law enforced, and I want to be a father.
Thank you.
Sober father. So thank you. Sorry to crash your budget parade.
Lori Wright, and if we could ask people to please line up so that we can move along expeditiously, followed by Audrey Calderon, followed by Victoria Kirshner, followed by Sammy Abdisa. If you don't line up, please. That'll help us move along. Welcome.
Good afternoon. My name is Laura Wright, and my experience with the Record Clearance Project has been a positive, uplifting, and life-changing experience. I was released from county jail in 2014 with a record of felonies and a history of drug abuse. I knew in 2014 would be my last time in jail, and that's because of the hope that the Record Clearance Project brought to me. While I was in custody, the Record Clearance Project came into my dorm and explained the laws that gave me a chance for a future. They also explained the Path to Expungement mentoring program, and I knew that I could use that as a guide as I figured out how to live without drugs and alcohol, which I'd used for every day for 17 years of my life. After completing my outpatient program and court-ordered Prop 36 successfully, on November 10th, 2016, the Record Clearance Project asked the court to terminate my probation early, dismiss my convictions, and reduce my felonies. The judge agreed. That day changed my life. Since then, I have graduated from community college and transferred to a four-year university, and I will be graduating with my bachelor's degree in social work in 2019. I plan to continue with my education and attend graduate school to get my master's degree in social work. This August, I will proudly have 4 years clean and sober. I have the freedom to apply for any job now without the fear of a background check because of this program. My life came full circle when the Record Clearance Project hired me as a mentor. Now I have the freedom to help others succeed on their paths to expungement. Knowing what it's like to have gone through the process myself, I can lead by example and be living proof that anything is possible if you just put your mind to it. I give people hope and inspiration to believe in themselves. I have seen this program change people's lives just like it changed mine, giving people a second chance to reach their full potential without the mistakes of their past limiting them now. I look forward to continuing to help others take advantage of the second chance this program offers. Please support this amazing program to be able to continue to do the great work we do. Thank you.
Thank you. Next speaker, welcome. Come on up.
Hi, my name is Audrey Calderon, and I started working with the Record Clearance Project in fall of 2017, and this has been one of the most rewarding experiences throughout my academic journey. And I was raised in South San Jose. I currently live in Morgan Hill, and I have seen how a criminal background can affect disadvantaged groups. I grew up in low-income areas and came from a broken family, but I was able to successfully graduate from college. Unfortunately, I had friends that did not get those same opportunities because they ran into trouble due to a lack of guidance because they had a single mother that was always working. My friends could not afford an attorney and now have a criminal background. They are now prevented from obtaining affordable housing, schooling assistance, and food stamps. When people come back from jail, they're forced to wear their criminal backgrounds on their forehead for the rest of their lives. Thankfully, there is a possible solution. Expungement gives people a second chance and makes people feel like their community has faith in them. No person should be judged by his or her past mistake, and Record Clearance enables individuals to live the life they dreamed of. Throughout my work with RCP, I have volunteered over 250 hours helping clients through the expungement process, and I have helped 2 clients prepare court petitions, interviewed over a dozen people at drop-in advice sessions, and educated inmates inside of Elmwood Jail and the Re-Entry Center. On occasion, I attended events to educate people on record clearance and inform them about our services. I've also worked with the Pathways to Expungement assisting mentors inside Elmwood Jail. And working with the mentors has been a rewarding experience. They've been through it, and so they can truly be able to help the people that are experiencing those same things. And mentoring works with clients before they exit the system to help them transition. And this spring at Record Clearance, we help clients get job promotions, higher pay, and become first-time homeowners. And look at RCP as an investment into the community because once clients go through the expungement process, their contributions, spending, and taxes cycle back into the economy. I hope you can help us continue giving people a second chance by funding our program. Thank you.
Thank you. Next speaker.
Hi, my name is Sammy Abdisa. Growing up, I hung around the wrong crowds. I was lucky enough to get away from that kind of crowd and attend college. I got my associate degree in justice studies from Mission College, and then went on to graduate from San Jose State with justice studies. From the RCP program, I've learned a lot of things helping clients. Since my early childhood, I've always wanted to give back to the community. thanks to the opportunity that RCP gave me, I have done that. Where else could I have gone to tell, people in jail about the legal rights? And RCP gave me that, opportunity to go into Elmwood, tell the women, that inmates, about their legal rights after they come out and expunge their records. And the experience that I had with that was, man, I can't express it in words, is what they say afterwards. Just us coming in, telling them, what their legal rights is, and they come up to you and so appreciative of everything that we've done. And I believe everybody deserves a second chance. That's one thing that I believe in, and no matter what, Record Clearance Project gives people a chance to do that. I've worked on about 3 petitions, prepared 3 petitions in court for reducing and dismissing. I've also spoke at the Resource Center just about legal rights and what they can do for the next step. We've done speed screening where people come in and show us the rap sheet, and we tell them what's on the rap sheet, what the next process is, and the reward is just, they thank you so much, and just the little things that we do for them is amazing. I'm just here to ask everybody, the Record Clearance Project is one of the most rewarding things I've ever done, and I hope you guys support it and, let it go on more.
Thank you for your comments. All right, Victoria Kirshner to be followed by Mr. and Ms. Ogamba, and then Monica Hernandez, and then Stacy Smith, I believe, and then Zalima Pimentel. And if you would all line up, that'll help us move along. Thanks. Welcome.
Hi, my name is Victoria Kirshner, and I would like to start by thanking everybody for the opportunity to share what the Record Clearance Project has done for me. It has been a journey of approximately 10 years. My sobriety date is August 23rd, 2002. This year, one day at a time, I will celebrate 16 years of sobriety. On the 7th of June will be the end of my journey when I finally get to get my prison record expunged. I had ongoing trials and tribulations throughout my whole younger adult life going in and out of jail. I had lost hope in everything and every opportunity and was not able to excel in anything that I did. The team is so remarkable. They saw hope when I saw little. Moving forward, never giving up, taking it one step at a time and one day at a time, I have been able to almost completely expunge my record and make a 360-degree turn. Now being employed with the Record Clearance Project as a mentor is the most amazing thing that could have ever happened in my life. I get to go into the correctional facility and share my experience and strength and hope with others, even being able to share with them that I've been housed in that exact same unit and that I'm speaking at in the present moment. That has, that I'm speaking in at the present moment. That has really impacted inmates to know that I have walked in their shoes 100%. I feel so blessed to be a part of this amazing team at this time. There is nothing too big or too little that they are not willing to tackle and to accomplish when it comes to helping people transform their lives one petition at a time. The Record Clearance Project is creative and responsive. When it turned out that some of the people at the Reentry Center had heard our presentation before, the team included new material teaching people how to do legal research and legal writing. This is an amazing service. Please support the Record Clearance Project in continuing this amazing service that they do.
Thank you.
Thank you.
Welcome our next speaker. Please come on up.
Hey everybody, my name is Uchechukwu Ogamba. I'm also part of the Record Clearance Project. First thing I wanted to mention is as a community, it's important that if we seek to see improvements within ourselves, that we also look at our communities and seeing how they're also improving. With the Record Clearance Project, I feel like it's really good for the community because of the changes it has in people and the impact it has on the community. Growing up, I grew up always being a little afraid of the justice system, just being confused and unaware of the knowledge and stuff it has. Going through the Record Clearance Project has cleared up a lot of these things, and it's actually made me an advocate for the other people that are also scared. And I feel like getting into the Record Clearance Project helps bring clarity for a lot of people not understanding how everything works within the justice system. The Record Clearance Project, it's just me dealing with clients on a day-to-day basis. I've seen how it's opened them and given them light. And being that light is important for a lot of people. A lot of people are forgotten and not thought about. And this is what the Record Clearance thrives on. It thrives on getting these people who are in the dimmest parts of our communities and bringing light to them. I feel like it's very important because just the smiles and the tears I've cleared up. I've seen some tears of joy to tears of sadness. And I feel like it's important to, change those tears of sadness into tears of joy. One of my clients, he couldn't visit his daughters or go to his daughters' games at the school, or participate in volunteering at the school. And the Record Clearances gave him that ability to do so. He also works a lot in the community. He has an AA meeting that I feel like the Record Clearance Project has allowed him to grow with. And people from this project are actually coming to the Record Clearance Project. So I'm just here to ask you guys to help support the Record Clearance Project because as a community, it's going to make an impact that will help us grow.
Thank you very much for your comments, Mr. Ogamba. Next speaker, please. Welcome.
Thank you. Good afternoon. My name is Monica Hernandez, and I am also a student from the Record Clearance Project. I have served over 240 hours for this project, and I believe it is important and pertinent to support this project because it mostly helps lower-income minorities, which is something that we see a lot of them have trouble with clearing their background and wanting to get jobs and housing and licensing if they want to continue their education. I will talk a little bit about what the clients have said to us when we provide these services. So some have commented that their probation officer never gave them this information, such as if you complete probation, some cases are meant to be mandatory, meaning that they have to be taken off of their rap sheet. Many of them also mentioned how it would be helpful and that would be motivational for them to actually complete their probation if they knew that information. When we provide mentoring services as well, a lot of them ask or mention how knowing this information would really help them continue with their pathway to later on expunge their records. Also, I know our services are being talked about outside of this county because when we provide advice sessions, people from San Benito County come for our services, and although we could only help them so much, they are still thankful to know that we could help them by telling them whether their cases are mandatory or discretionary. It is also important to notice that attorneys tell their clients to go to the Record Clearance Project and ask for our help. I just want to thank you all for taking this time to listen to us, and please support the Record Clearance Project.
Thank you. And are you currently still enrolled as a student? Did I understand that correctly?
Yes.
Well, I have no authority whatsoever, but we want to recommend extra credit for all the students who came to
Thank
spend
you.
time with us today. All right,
I
so you can
appreciate that.
take that back for what it's worth. Next speaker.
Hi everyone, my name is Zulema Pimentel and I am part of the Record Clearance Project staff. I joined the Record Clearance Project in 2015 and since then I have seen how transformative this program is, not only for the students, but for the clients that we serve as well. I've seen how this program changes the lives of many clients. It has helped reunite families. It has helped clients obtain the job they dreamed of. It has helped them get a promotion that they couldn't get until they cleared their record. It has helped them with housing, among other things. As for the students, I have seen how this program reduces stereotypes and it improves social responsibility. I am a first-generation college graduate, and I always thought that law school was far from reach. This program gives me the opportunity to do life-changing work that makes second chances a reality for people. And because of this program, I now plan to attend law school to help enforce people's legal rights. So today we are here to ask if you can please support the program that Santa Clara County is very fortunate to have. Thank you.
Hi, my name is Anaí Beltran. Basically the same story as Zulema just spoke. I'm also a graduate from San Jose State University. I'm currently the admin coordinator for the program. And I'm also here to ask for your support. Our program's just been life-changing, as you can see from our students. It's an invaluable experience. For myself, I was enrolled as a student. I'm now working for the program. I'm a certified fingerprint roller, which is a service that we provide. Just starting last year, we've already done 52 live scan events, helped 413 individuals, 78% of whom were indigent, so they didn't even have to pay for the rap sheet. We also taught them how to read their own rap sheet. So these individuals come here asking for services and are either turned away because they can't afford it or for some reason make too much money. Also, as a student, my perspective was going into law enforcement. I still want to go into law enforcement, but now is in more social work. I want to be also an attorney and give this authority to people who just don't have the power to go forward. And just the record clearing project just empowers students, empowers staff members, empowers our clients themselves going for their education. We heard from Laura Wright, who's now going to CSUMB, a speaker that was going to saying that he's from De Anza College education counselor. It's just we've had so much services out here, and we haven't seen the support, and we would love to have you guys support us, especially with students who are volunteering the time. We've had over, in the past 4 months, 5,500 hours of uncompensated service. So a lot of the stuff that we're doing now is free. So I would really, really hope to see your support come through soon. Thank you.
Hi, my name is Jesus Ruelas. I'm also a client with the Record Clearance Project. But before then, my PFN is DTR717 and my CDC number is F94968. I was very fortunate to find out about the Record Clearance Project because I thought I'd always have to live with my background for the rest of my life, and I was never educated on anything, or I thought it'd be really costly to kind of go through that process. I'm currently also a San Jose State student in the master's program in counseling and education, and I also work at De Anza Community College as an academic advisor. So I try to kind of go out with them to the Elmwood facilities and kind of bridge those gaps. I really think what the Record Clearance Project is doing here is really educating our community and educating just people in general about the resources that are available to them, and they should be taking advantage of them. These people are, people's fathers and mothers, brothers and sisters. These are people from our communities that deserve the resources that are out there. Again, I'm also currently a client, so I'm also going through the process, which has been great, the way they just make everything very just easy to understand. Because as you know, your language y'all speak is very complicated, and that paperwork, we really don't know what that means. Right? So to have people be able to translate that for us and educate us, I think it's something huge that this community needs. When those formerly incarcerated come back out to their communities, they're met with very little resources, if any at all. So at least for them to be able to get educated on what's out there for them, it's kind of up to them to kind of, put that foot forward and, make something of themselves. I'm a perfect example that people make mistakes. I'm sure y'all made some mistakes. You guys just didn't get caught, right? These people did. So that's the reality of it. We're all human beings, so I hope that you continue to support the Record Clearance Project. Thank you.
Thank you. And Stacy Smith, I believe, is the last speaker. Yes?
Yes, sir. Just wanted to ask through the board to some of the staff, Mr. Smith and Mr. Williams, have you heard my name in the last month and a half, Stacy Smith?
Ms. Smith, I'm sorry we don't accommodate a back and forth question and answer here, but feel free to use your 2 minutes to communicate directly with us.
Okay, not a problem. Can't communicate with staff. Part of my problem has been communicating with staff, and I wanted to find out if my issue has risen to the top levels in the county counsel's office. I sent Mr. Smith and Mr. Williams and the clerk an email out an hour before, maybe 45 minutes before this meeting. It was an email thread, a very long thread that I had with a back and forth with one of the county council employees. I met with her yesterday, and I was trying to find out why is it that I've been waiting so long to hear back from her on a critical point, and all I got was smiles. Okay, all I got was smiles. So that's what I was trying to find out. Because it seems to me that you guys do a great job and you have, great staff working with you, but sometimes the staff can get between us and you so that we can get things moving. CPRA has not really been supported by Governor Brown. He sent a clear signal last year in the last session when he vetoed the Bonta bill, AB 1479. I sent you guys a copy of that. I don't know if you got that. I think we really need to work on this because I'm sitting on PRAs, very serious PRAs, that are not being responded to appropriately. And I'd like to get your assistance in helping me get this moved forward.
Great. Can I ask you to hang in for just 1 second? Thank you. Mr. Smith, as I understand it correctly, you've got some Public Record Act requests into the County Council's office. They're not being responded to in the fashion that you think is appropriate, and you'd like some assistance in finding out what the prospects are for moving those requests through the system. Do I have the facts right?
That's mostly right.
All right. Well, mostly right's a start. So what I'm going to do is I'm going to turn to the County Council and ask who he'd like to have connect with you off the dais here in the next minute or two, just to make sure that we have some follow-up on this. And if you can just hang in with us for one more moment.
Thank you.
Mr. Williams?
We'll have Assistant County Counsel Doug Press just talk with him and get some information.
Great. Mr. Press, appreciate your willingness to step away from the dais for a minute. Mr. Smith, let's see if we can make some progress. Okay?
Thank you, sir.
Thank you for being with us today. All right, let me confirm with the clerk that there are no other cards under public comment. There are not. And then that means we have concluded public comment. Thank you all for being here today. And that takes us to item number 12, which is the county executive's recommended budget for departments reporting to the Health and Hospital Committee. And we have a number of items, 12A through G, before we get to public safety and justice. But it occurs to me, Supervisor Yeager is the chair of the Health and Hospital Committee. Do you want to offer some preparatory remarks at this point?
Yes, thank you. It's been such a remarkable year that I thought I would just cover some of the highlights that I know President Smitty and you are very familiar with as we serve as chair and vice chair of the Health and Hospital Committee. But locally, it's been a very good year for the health and hospital system. We continue to provide great care to an expanded number of patients. We opened a beautiful state-of-the-art new hospital wing at VMC in December, and all of us were there and know really what a remarkable structure and building it is. In March, we became leaders in transgender health by approving a trailblazing specialty clinic at the Downtown Health Center. It's the first clinic of its kind in our county. We've made progress reducing the number of non-acute patients in the hospital, freeing up beds for patients who are acute. We've gotten Getting to Zero off the ground. We're doing great work to educate providers and the public about new tools in HIV prevention. We've doubled the hours of the STI clinic and substantially increased access to PrEP and PEP for uninsured and underinsured patients. The number of cities following our lead on tobacco control continues to grow. With our help this past year, Palo Alto adopted our exact TRL policy, and Los Altos strengthened their policies to reduce secondhand smoke. We've implemented a bold whole person care program, which is allowing us to draw down $22 million in new federal funding each year to improve the health of thousands of our highest utilizers of county services. In behavioral health, we've opened the Sobering Center, launched community-based crisis residential services, and new mobile crisis response teams. We've implemented the drug Medi-Cal waiver, which is bringing enhanced dollars and more substance use disorder services to our county. We continue to implement changes in custody health to better serve our inmate population. We've implemented Health Link in custody over the past year and launched Health Link in behavioral health in February. Also, the enormous success of the ACA continues on in Santa Clara County. Valley Health Plan nearly doubled enrollment in its covered California plan this year to more than 13,000 members. So I want to congratulate our health and hospital team, our employees, and our community partners. The progress we've made this year and in the past years is truly remarkable. And so Jeff, Renee, Paul, everybody on the team, really want to express my thanks. I could have made that list twice as long, but it's really amazing the things that we're doing. We have the resources to do it, but as important, we've got the right people, we've got the right facilities, we've got the right financing to really do some remarkable work in this county. I just really want to thank everybody.
All right, I don't think you could have teed it up much better than that for our staff. Thank you, Supervisor Yeager, and thank you for your work in those various arenas and as chair of the Health and Hospital Committee. That takes us to item 12. Who's going to present on this one, Dr. Smith?
Greg Aturi is going to take over and make the presentation.
All right, Mr. Aturi, we look to you. We do have some cards on this, but we're going to, do we have a comprehensive overview, or we're going to take them ABC? Can we start that one?
Yeah, we'll take them ABC, Mr. President.
All right, then I think what we'll do, before we go to the next one, Mr. Largent, you want to come up? You have a card under this item. Please take 2 minutes. Sorry for that. And then I do have one card from Sparky Harlan, who wants to speak on 12E. Ms. Harlan, where are you? Somewhere there. Would you like to speak now, or would you like to wait till we get to that item? I can speak now. All right, we'll have you line up behind Mr. Largent, and then we'll have a comment on these items done. Mr. Largent, thanks for your patience.
Thank you. I don't know why I call this stuff up here all the time. I rarely ever open it up. I have participated in all the health and hospitals meetings. I annoy the hell out of them also and go show up for public comment there also. You know, it all sounds great out there at that hospital, and when you drive by it, you see, like I've said, all these shiny, beautiful buildings, and, you know, the people that come from wealth, power, and influence, they get that beautiful bed and that flat screen TV, and they get all the amenities. And then you go right in the back of that place, right near that psych ward back there, and that is the most pathetic place I've ever seen. Okay, and they're still not running the mower back there. They're still not cleaning that building up, and it's still an absolute toilet. So it kind of just shows you best foot forward in the front of that location, then you go into the back. When are we going to bulldoze that thing back there and put an actual mental institution and a real psych ward in our county? We don't have either one of those. So when I come to these meetings at the health and hospitals thing, I really keep wondering that. And we still have a problem that when somebody wants to get drug treatment in our county, they still get on a waiting list. Now, I got on that waiting list a lot because I was determined to get treatment, and I've never gotten drug treatment. This is my treatment because the county system is a failure. Maybe I should be going to the AA and NA meetings and not the meetings here, but this county, I consider this system a failure. I watched at the behavioral health subcommittee here, and we had another doctor on the panel, and he said the same thing, that people are still put on a waiting list and they're still not getting those calls back. Well, we need to scoop these people in and get them off of dope. And we need to get them off of dope fast, because if they're on for more than a year or two, they're toast. They're never getting off. People don't get off meth. I was fortunate enough, I was only on it for a couple of years. We have to get those people in right away, and it's not going to happen. And that psych ward is pathetic. The women are terrified of the men, and they give you orange juice and Doritos, and I did a stint there for about 6 hours, so it's a joke. Thank you.
Thank you. Next speaker.
Good afternoon, Sparky Harlan, CEO, Bill Wilson Center. I've been CEO 35 years, and I've probably sat through 35 of these budget hearings. So I wanted to answer some of those questions yesterday when you talked about the 5% set aside, because I remember those days. But as you're talking about building your infrastructure, I would ask you to include your nonprofits in a different kind of conversation also. This isn't about a cost of living increase, but as you add monitors and staff, and I'm thinking of that 100,000 you're giving to your Office of Procurement to do training of their staff, you have to think of that impact of once they're trained, what they're turning around and asking of the CBOs. For the Office of Supportive Housing, just an example, when I do a bill for them now for Bill Wilson Center, each bill is about a stack of paper that high. Every single piece of paper I am having to copy, bill, and send it to them in hard copy. That's not a requirement, but it's how the monitors have interpreted what they think is required. So every time you hire a new monitor, they ask for different things. They've been trained differently. And I'm fine if they want to ask for it, but I think it might be time to have the nonprofit CEOs, CFOs sit down with your CEO and procurement staff and say, as we're building infrastructure, what are the needs of the CBOs that match your needs? If you want more evaluation from your department, that means more evaluation for us, but it's an infrastructure cost. I would also say put in a fund for merger and acquisitions. If you want us to combine our services, we can do that if there's a fund to do that. So I'm requesting that you think about that as you move ahead with your infrastructure.
Thank you for your comments. Now, Mr. Ituria, thank you.
Thank you. President Smitty, members of the board, Greg Ituria, County Budget Director. And this afternoon, we will go through the recommended budget for the health and hospital system, followed by the public safety and justice system. Beginning with the health and hospital system, I'd like to take just a minute to review a couple of the smaller budgets, go into the Valley Medical Center budget, and then seek questions for that hospital system from the board. So initially, the Senate Bill 12, which was signed into law in 1987, provides supplemental funding for local emergency services. It consistently stays at $3 million per year funding and is used for patient care. And then another of the smaller budgets, the Children's Health Initiative. And this is a $3.4 million recommended budget. It is $400,000 more than last year, and is necessary to expand enrollment to meet the anticipated enrollment for the Healthy Kids program. And just as a reminder, this program provides health care to uninsured children. And then these all are clearly tied to our health and hospital system, particularly our Valley Medical Center. And so at this point, I would like to introduce the recommended budget and appropriation for VMC at $1.9 billion. This includes $45 million in recommended actions and providing resources for a variety of expanded services, including to expand the complex care coordination services and specialty access, to establish a post-acute care team and a patient transporter team, provide funding for an ultrasound clinic at the Valley Health Center clinics downtown, as well as enhancing language services and the VMC laboratory services. And it also provides resources and adjustments to realign ambulatory care resources for improved care. The recommended actions also augment resources for environmental services and increase labor and delivery surgical services, provides additional staffing for the burn center, and establishes a health information management at behavioral health, and establishes patient transporter teams for Valley Specialty Center. It enhances resources to address patient census increases and for migrating VMC accounting staff, implementing new HealthLink modules, as well as augmenting resources in nutrition and food services and palliative care services, as well as actions to support and expand the unit-based team initiative. Further, it expands mental health services at the reentry clinic and expands rehabilitation research center resources, enhances communication and customer relations, and resources to improve analytics and resource management and fiscal operations, as well as the various transformative initiatives at VMC, including enhancement of therapy services and improving operating hours at the VMC. Further, the recommended budget includes the transfer of positions associated with the centralization of information technology services at ISD, which we discussed yesterday. And further, it deletes a few chronically vacant positions that have been difficult to fill. So at this point, I would like to recognize that we have Dr. Lorenz and Deputy County Executive Renee Santiago, and as well as ourselves, to help address any questions that the board may have for these budgets.
Thank you for that introduction. Gentlemen, anything else at this point, or shall we just turn directly to the board members to begin?
Not at this time.
Thank you both. Supervisor Yeager?
Thank you. Just a couple quick comments. Good work on all these projects that you're doing. But I'm glad to see the added positions in the unit-based team work. The Supervisors Committee and I are familiar with it because of presentations we've had. But we've had a lot of success with these projects. We've really seen how valuable it is to engage all staff, especially frontline staff, in generating ideas to improve. And so having dedicated permanent staff to work on this unit is really worthwhile. But I don't know, if maybe for the interest of the other board members, Renee or Paul, you want to just talk a little bit about how this works and why it has turned out to be so successful.
Yes, and good afternoon, Mr. President, Board of Supervisors. The unit-based teams are a labor management partnership. I believe we had a presentation here to the full board. We started as a pilot. It's grown quite a bit successfully. It engages all the labor unions, including our frontline staff, nurses, doctors, and ancillary staff, in identifying very meaningful projects that are at the operational level that makes very specific improvements in the quality and the care that we provide. We've grown to about 70 projects now, and what we're looking for is support and staff so that we can actually scale it up and make it sustainable. We like to have 100 teams doing 1,000 projects every day, every year, and so that's one of the things that we have as an inspiration goal in the future, and this is a good step towards that.
No, it's just great, and just the benefits, but it just engages all of the employees into the process, and that they know that their voices are heard and they're part of the team, and that's the other very exciting thing about it. I also appreciate the 35 nursing float pool positions. I think it's a wise strategy to reduce our reliance on extra help and overtime, but it still allows us some flexibility. We obviously do need flexibility to be able to adjust to the fluctuating census, but I appreciate the administration's effort to work with our nurses and the RNPA on this subject. Those are my only comments, President Smidian.
Thank you. We're going to go to Supervisor Cortese and then Supervisor Chavez.
And I'm not sure if this is best directed to the county executive or to one of you on the panel here today presenting. Just got looking at notes from my staff based on questions. We did obviously a lot of question and answer back and forth before getting here since the budget first arrived on our desk. And thank you all, during this whole study session process. I'll just make a universal thank you to everyone who got back to us with very specific answers on things, especially Greg. Thank you for that. I'm not sure if this is accurate, but I was asking what the total budget is for VMC, and what I got back actually was that there's a remaining annual subsidy of about $116 million from the general fund, and I don't know if that's accurate or not. If it is, it sort of seems substantially reduced from where we were at the time I joined this board, and I know it's for the most part been declining over the years. But I'm wondering if either now or at some point between now and when we adopt the budget, if we could get a chart, a graph, of not only that trajectory, but what the trajectory has been with regard to growth in that system, because it's not as if we've just been cutting like we would during concession times or downturn or freezing positions in order to achieve a stabilized general fund contribution. I hate to even call it a subsidy, but it seems to me that there's been tremendous growth in that system even through the deep recession, and yet at the same time we've been able to keep that contribution from the general fund from growing and turned it around. Is that all accurate statement?
Yes. Let me give you a little bit more detail. You're right. When you first started, the general fund subsidy was in the 200+ million range, and we've been reducing it dramatically to the point where it last year was in the 80 million range. This year, you'll notice it bounced back up a little bit, but that's really only because we changed the way that we recorded the depreciation in the new buildings. We moved the buildings into the general fund, and therefore basically VMC pays us a lease on the buildings, so that the depreciation ends up in the general fund instead of in the enterprise fund. We did that for a number of reasons, but probably most appropriately because the buildings were actually built with bond funds, not funds from the enterprise fund, so getting the depreciation in the right spot is important. That caused a little bump in the general fund subsidy, and without that it would have been actually lower than last year. So we'll give you the details, and also I should give you a heads up about the future. Next year we will be calculating the subsidy differently, because in the past what's happened is the realignment funds from 91 have been incorporated as part of the subsidy, and also costs of the custody health. With the changes in realignment and the changes in the way that realignment is backfilling social services and other services and been denominated for certain other services, we feel that we need to pull that out and register that separately in the budget, because otherwise we're not getting a really fair understanding of how the realignment is being spent in the organization. So next year that will be changed, so that will change the way that the subsidy looks. But all that is my way of saying yes, we'll get you the information you request.
Thank you. Through the chair, I think those are a couple huge footnotes that should be on on whatever the chart or graph looks like, to qualify those changes. I mean, depreciation and moving to a lease structure is just a paper transaction,
Right.
as opposed to a fiscal management problem or a challenge. And that's what I'm interested in seeing. I don't know what we could ask questions once we get that, as in terms of hypotheticals and extrapolation as what would have happened had the subsidy continued to track the growth of the health and hospital operation. I'm pretty sure it would be way out of hand. I don't want to speculate, but
yes, it would.
very important that it's not. But I appreciate you getting us that information, not just for us. I think it should be shared with the public, so the public can see, including our critics, how well cost containment has been achieved, irrespective of not only the radical restructuring of the system that had to take place post Obamacare, but also just the growth. I think it was the only fund in our entire operation here at the time of the Great Recession that kept adding FTE, albeit small numbers, but kept adding, and yet that general fund subsidies evidently been contained. So
yes,
I think that's the biggest thank you to all the people who have had to do the hard work of trying to get that all to happen at the same time.
right.
Growth and cost containment to happen at the same time.
Well, they've done a great job, operations and finance and leadership. As you point out, we've been more and more busy, and the subsidy continues to drop. But more importantly, our quality numbers continue to go up. So seeing more patients, doing a better job, demonstrating it effectively, and making sure that we're as cost efficient as possible. But we'll get you those numbers before
Thank you.
Before I go to Supervisor Chavez, I would just add, and Supervisor Yeager and I have had these opportunities to review the subsidy levels at the health and hospital. And I will say that the various changes in accounting methodology and the definition of a subsidy makes it frankly hard. The gentlemen who are here with us today were very patient as we said, well, but why does it look like this between this year and that year, and why does it look like that between that year and this year? And there's always an answer to that question, but it becomes very difficult looking back over the course of, say, the last 15, 20 years to really follow what's happened from year to year quite as crisply and easily as you would like, just because of some of these changes that have been described. Supervisor Chavez?
Thank you. Just on the body of work relative to the general fund risk, and I'm using the term risk mostly because I am concerned as we watch what's happening with the Affordable Care Act at a federal level, and while we continue to sign people up for programs, I'm nervous about what programs will actually be available in the next couple of years for folks. And so it presses me to ask this question: do we have a reserve that we are setting aside particularly for people, anticipating some number of people losing their insurance?
We have a number of reserves, well, significant reserve, I should say, placed in the budget for unexpected eventualities. And within the enterprise fund, there are some reserves set aside for particular audit issues and potentials that could be a result of the actions at the federal level. We think that given that and the increased efficiency of the organization, plus the fact that, we're focused on providing care to everyone, will mean that we'll be able to deal with it all financially. Now, a lot of that is based on a lot of great work that Renee and others have been doing at the state level to make sure that as the 1115 waiver is implemented, that we are financially advantaged by that with QIP and EPP and other funding sources that frankly we're doing better at than the other county agencies. But at this point, predictive-wise, we can deal with pretty much about everything except for total elimination of Medicaid, which won't happen. So, to answer your question simplistically, yes.
So let me just say what I remain concerned about, and that is that I know that the county, Dr. Smith, under your leadership, right away was bullish on hiring a whole number of people within the Social Services Agency Department to make sure we could sign up as many people as we could for every kind of product available in order to protect the overall organization. And I think that's laudable and very wise. My concern is that the chipping away of the Affordable Care Act, it's not actually the removal of it I'm worried about. I'm worried that the chipping away of it will continue to destabilize the market. And I recognize that California's market is different than other places in the country, but I remain concerned that it appears to me that we're slowly losing options for insurance companies, even in terms of who will provide services in insurance products in what part of the world, and how perhaps the ripple effect of what's happening in other states may impact us in California. That's what prompts the question, because I realize with such a low number of people that are uninsured now because of the good work of you and your team, that in many respects we have the freedom to do some expansion where counties right around us are not in that situation. And I appreciate your point about the waiver. I also think that some of that early work you did just paid off. I think people weren't as caught up. So I'm just putting that out there as a caution because it occurs to me that that particularly the investments we've made here and investments we're going to talk about relative to custody health and mental health services, that we are doing what we should be doing, but that as we walk the agency out closer to the edge, as we're trying to do relative to making sure people have service, that we may need to think a little bit about our rainy day fund, not just relative to liquidity and liquidity for however many months or weeks of being able to pay people, but also in terms of making sure that we're not kind of doubly hit. And I hear what you're saying, that you've thought, you guys are thinking about that, and you've already kind of covered it.
Yes. Maybe I should put something forward to the full board so that you're not surprised in the future when we come back to it. But you're right, the market is changing dramatically. Part of it is because of ACA, part of it is because the increasing population, part of it is because the older population, and part of it has to do with the level of poverty in different areas. We don't see the poverty so much when we walk down the street, but actually there is a significant number of people in our county who are living in poverty or near poverty. And so in order to deal with all of those priorities, basically all of the private sector health systems are trying to consolidate, expand, spread the risk across a larger number of patients. We're taking the same type of approach in the sense of expanding. Right now, we're planning for covering at least 400,000 lives, which is basically a little bit less than twice the number that we're doing at this point. But last week I told the health and hospital staff that even though I named 400,000, the reality is it's going to be about 800,000, which gave them all heart attacks.
You mean 800,000 that we need to hit in order to create this balanced plan you're talking about?
We're going to be
we're going to be talking about the AEDs next.
We're going to be expanding significantly, basically doubling our size, not only because we need to do so to deal with our patient population and the need, but also because it's going to be important for us to spread the risk and be larger. And with the loss of the services at the two Daughters of Charity Hospital that have been dramatically reduced, and also the concomitant outpatient services that have been reduced for that population that we basically are responsible for, our organization is going to need to get bigger. And we're also looking at it from the standpoint of Valley Health Plan, getting bigger, offering new services, offering expansion in covered California. So the system's going to get even bigger than it is.
So just something I would request of Ken and Joe. I know all of these issues come before your committee, and one request that I would make is whatever that growth plan is, that it get presented to the committee, and then as quickly as possible to the full board, because I think the point you raised about the growth here, the relationship with Valley Health Plan, the relationship with the Family Health Plan, and other opportunities that may exist in the world that will also drive a capital need. If that could all be laid out, I think it would better help us put the analysis of the VMC campus, for example, in context. And even it even brings to mind the mental health psychiatric services for children that we've been discussing, like all of that which I think it would just help to see that in one place. Budget's a good time to just take a kind of a clean look at the top lines, but that in-depth understanding I think is going to be critical.
Will do.
Thank you.
right. Anything else on this item? If not, then we'll say thank you very much and move on to the next item. Mr. Arturia.
Okay, thank you. Next, we'll introduce the recommended budget for community health services. The recommended appropriation is $21.5 million. This includes approximately $300,000 in recommended actions to add resources to enhance services for clients at tuberculosis, PACE, and infectious disease clinics, as well as addressing expansion of the primary care access program and relocating enrollees. It also deletes a chronically vacant position. And at this point, I see we still have our executives here to help address any questions regarding the Community Health Services Budget Unit.
Supervisor Yeager.
Yes, and as my colleagues know, we're talking about the Crane Center, the PACE Clinic, and the TB Refugee Clinic under our Community Health Services. But Renee or Paul, I was wondering if you could talk about the plan to ensure sustainability of the expanded hours in the STI clinic. I understand the positions and related funding to do that may be coming forward as part of the revised recommended budget, and just wanted to see if that was correct.
Thank you, Supervisor Yeager. Yes, that is correct. We are working with the County Exec's Office and OBA on a revised budget.
Great. And then for Renee, I'm also glad to see the requests include a staff person to support the expanding the PCAP program to 20,000 enrollees, right. Which is very ambitious. But it's always been the goal to reach those levels. Do we need any additional funding to pay for the PCAP program itself?
At this point in time, Supervisor, we're not looking for additional funding. Obviously, it intersects with the discussion that was before of more vulnerable people in our community falling through the cracks potentially out of the federal rules and regulations. So we're looking to make sure that we continue to provide the coverage as well as the continuity of care, and we see that as appropriate at this point in time.
Remind me what our numbers are now with the PCAP?
Well, we're up to more than 5,000 enrollees. Okay. And this is, again, in partnership with our federally qualified health centers, where we're leveraging just about every funding that's available not only to us, but also in the community, so that, in fact, we can expand access to that community.
That's great. Thank you.
Supervisor Chavez.
Thank you. I wanted to ask if this is the appropriate place to ask this question, but just based on, Ken, the points that you just raised, will there need to be expanded resources to our nonprofit partners also? And I'm particularly thinking about that as it relates to the increase, at least what I've been reading in sexually transmitted disease as well. And what's well, anyway, not to dive too far into that subject, but is that also something that will, when you bring resources back for these clinics, will our clinic partners also be included, be getting resources?
Well, as part of our waiver-related programs, we're working very collaboratively and closely with all the federally qualified health centers, and we look at these things on a regular basis and annually. We'll be asking on a separate board action, a delegation of authority to continue those efforts in terms of leveraging the funding. And then in terms of the community health services also, we always work closely with them as well.
Well, specifically, I'm wondering if we're taking the trends that I'm sure you're going to be addressing and just recognizing who out there can be most helpful to us in terms of starting to address them. I'm particularly concerned about the reason that sexually transmitted diseases has really popped up is it does seem like on a national basis that there's some changes in I don't know if it's a lack of education or we stopped investing or what's happening, but even though we're continuing to have a lower love rate of pregnancy, although we've seen a little spike in that too in terms of teen pregnancies, the dramatic disconnect between that and STIs is so significant that it's made me wonder whether or not we are seeing that same sort of trend here. But maybe what you could, I don't know, Paul, Dr. Lorenz, did you have comments?
The doctor's in the house.
Well, just for the record, I think we all know that I'm not a physician. So just a quick comment. The anonymous program, the STI program that we have in place that we're expanding and stabilizing is clearly one strategy to provide for accessibility to these critical services. I think we're going to have ongoing discussions with the Public Health Department in terms of other strategies to further inform and educate the community about how to access these important services. And no doubt that it probably will involve the, other community partners so that we have geographic accessibility to these important services.
Yeah, I was thinking particularly about Planned Parenthood and I was thinking about the clinics that are on the farther outreaches from the county. And in Gilroy, I don't know if that's Gardner and Gilroy and Planned Parenthood in North County, but if that's the case, I would like to make sure that we're having discussions with them. Thank you.
Other comments or questions? If not, next item.
Okay, thank you. Next, we'll introduce the recommended budget for the Public Health Department. The recommended appropriation for the Public Health Department is just shy of $109 million. It includes approximately $200,000 in recommended actions to add resources to fund the Getting to Zero social marketing efforts. There are also adjustments recommended to realign the nutrition, education, and obesity prevention budget. And there's also a recommendation to delete a vacant position in the Public Health Department Preparedness Program due to revenue changes. And at this point, I see Dr. Cody is here to help address any questions of the board.
Yes, thank you, Dr. Cody. It's been a pleasure working with you and your team, and I think collectively the county is just doing some great things in public health that many other counties across the country are looking at. I think we've been very innovative with many of our programs and with public health, and be it childhood obesity, certainly tobacco, Getting to Zero, all those kind of programs that we're doing is personally very exciting for me, knowing that we're spending the resources that we have to on the public health. So just wanted to, again, thank you and your entire team. Was glad to see the additional funding for the Getting to Zero social media campaign. I think if we truly want to meet these goals that we've set for ourselves, we need to make sure that we put the right amount of resources into it. I was pleased that we now have $2 million in Prop 56 funds to continue our cutting-edge tobacco prevention activities through the Healthy Cities Initiative and the Tobacco-Free Communities. I noticed that we've added staff in that area. Are we fully staffed in terms of the new 8 positions resulting from this new tobacco funding?
I hope I've pushed this button hard enough. Thank you. Yes, we have the 8 new positions funded, and we have 6 of the 8 filled and are recruiting for the other 2, so we're almost there.
My understanding is that some of the folks that were funded under pitch, we were able to transfer over to with the Prop 56 funds. Is that correct?
That's correct. We've made a number of changes in chronic disease and prevention with the changing funds.
But that was a great relief to those workers who had been there with the pitch grant. It's great that public health employees benefit from the racial and healthy equity trainings, with over 300 employees receiving training on structural racism. So that's great, particularly with how much community input that we have. I understand the model on LGBT health will be implemented in the coming year. I was wondering what the plan might be in rolling out this type of training to other departments other than public health.
Thank you for the question. Yes, we have a vibrant Racial and Health Equity Learning Institute, which we're happy to share. I believe that the module on LGBTQ health has been shared with the work group in HHS, and we're more than happy to share it across the county as well.
Yeah, maybe at some point if you could maybe do an off-agenda report on how we're doing as far as taking that training to other departments as well.
We'd be delighted.
I think it'd be interesting, you know. And even though the pitch funding has ended, I'm pleased that we will continue to improve access to healthy foods through farmers markets and also promote active transportation for communities with the greatest needs. So pitch will live on. And I understand that the Public Health Department lease with the Sobrato Center for nonprofits will end this year. Has a new location been identified, and is there a need to include relocation funding in the current budget?
think I'll refer that question to Dr. Smith.
Yes, and I think we're working very closely, obviously, in terms of finding the alternative as well. And we're particularly working with FAF to make sure that it goes seamless in terms of the transition.
Anything else, Dr. Smith, as far as, I'm not exactly sure of the timing of that or when you're going to get booted out.
I think they'll have us until we have a place to land.
Oh, okay.
Right, and we have adequate funding. We're looking at various other appropriate places that might be utilized.
Great. Those are all my questions and comments, but again, thank you for all your great work.
Thank you.
Other members of the board? Let me just ask very briefly, public health, where's the intersection with vector control? Due to where I'm headed on this, just so you know, is the increase in tick-borne Lyme disease, which I'm wondering if there's any conversation about how we can perhaps address that in cooperation or collaboration with vector control, which is obviously a different conversation than the public health conversation, but the two intersect. Is this?
We work daily with the Department of Environmental Health, which includes the Vector Control District, and in general, our responsibility is on the human disease from vectors, and their responsibility is on controlling the vectors. So we work closely together.
Any activity on that particular front on the tick-borne Lyme disease?
I don't have updated data for you on tick-borne Lyme disease, but we're, of course, always happy to come back with that if you wish.
All right, well, I think what I'll do is ask my office to follow up with you directly, and what I'm interested in teasing out is whether or not there's some opportunity to do some work that might bring the rate down and provide some public awareness so that folks could take some precautionary measures. Okay, thanks. Anything else before we go on to the next item? If not, then we'll go to Mr. Iturian and say thank you very much, and we'll go to Mr. Iturian for the next item.
Okay, thank you. Next we'll introduce the Custody Health Services recommended budget. The recommended appropriation for the Custody Health Services budget is approximately $90 million. It includes $3.3 million in recommended actions. Actions include the addition of resources to improve administrative service, to enhance expertise in pediatric development and preventive care, upgrading equipment at both the main jail and the Elmwood locations. It also provides for maintaining case management and discharge planning services despite the loss of state funding. It provides resources for the provides adjustments to properly fund personnel activities, and it also deletes a chronically vacant position. And at this point, we're prepared to address questions of the board.
Colleagues, any? Supervisor Chavez?
Thank you. On custody health, just this is kind of a more of an overall question. Ken, you asked a question yesterday about services for children in in custody, and was this the area that you were looking at? It was another kind of service. So just a quick question about your work here. Are we doing any sort of evaluation overall of how our custody health services are working and doing any kind of customer service as part of any of our new budget work?
I guess I'm not quite clear what you're asking, Supervisor.
I'm wondering if, I know you've been doing a lot of work to shorten the length of time it takes to get someone's services, particularly around behavioral health issues. I just wondered if overall between the work that you were doing in the jails, had we figured out a way to do consumer or client satisfaction surveys? Are we meeting people's needs well enough? Have we done any of that, or have we thought about doing that in custody health?
We've definitely thought about doing it. We don't have a formal method to do that just yet. I'm certainly willing to look at different methodologies to try to get to that. Part of what we do is look at the input as sort of anecdotally, we look at the input from groups like MHAP and Debug, and certainly try to work with them closely to see if there's what levels of issues that they're hearing about when they go in to the jail setting. But as far as a formal method to do that yet, no, we don't have that in place.
Thank you.
Supervisor Yeager.
Yes, thank you. And maybe, Jeff, this is more of a question for you, but I understand we've been funding the Traditions Psychiatry contract using assumed salary savings for the county behavioral health teams, but now we've been able to hire for some of those county teams. Since we've had success hiring these teams, do we still need the Traditions contract, and when do you think we'll be able to wean ourselves off that contract?
We've had some success hiring psychiatrists, but not as much as we need. The board, in response to litigation, appropriately approved us creating 10 teams of staff to respond throughout the entire custody system for psychiatric issues. And so we feel that it's a priority to make sure we have those fully staffed, certainly until we can prove that, there's need for less, or, come up with statistics that show that we need to have less. At this point, we don't need to have less. And so I don't think I can predict exactly when the Traditions contract will be able to be eliminated, but I can say as soon as we can hire sufficient staff psychiatrists, we will.
Okay, thank you.
Any other comments or questions, colleagues? If not, we'll say thank you and go on to the next item, Mr. Arturi.
Okay, next we're introducing the Behavioral Health Services budget. The recommended appropriation for the Behavioral Health Services Department is $519 million. This includes $4.3 million in recommended actions to provide resources to improve billing and revenue cycle. And also it does incorporate a number of actions we reviewed yesterday to improve information services technology and projects, and the share of cost towards those endeavors. At this point, I see that we have Ms. Tully, Director Tully, here to help answer questions.
Ms. Tully, any opening comments, or should we just look to see if there are comments or questions from members of the board? Colleagues? You got away clean. Thank you very much. Thank you. Mr. Arturi, next item.
Yes, the next item is the Emergency Medical Services budget. This includes a recommended appropriation of $6 million, and it does include an adjustment to reduce the transfer from the EMS trust fund to the general fund, removing the prior year one-time allocation for AEDs. It's really a technical adjustment, and otherwise the current level of services is recommended. At this point, available to take questions from the board.
Colleagues? Here again, I think we're good to go. Thank you very much. Next item.
Okay. Then the next budget for presentation is the Valley Health Plan. The Valley Health Plan recommended appropriation is just shy of $540 million. It includes $3.6 million in actions, including the addition of resources to move the finance enrollment claims and member services business process in-house. Further, it provides adjustments to revenue and expenditure estimates for several lines of service to adjust to the participant count in each of those lines. Further, it deletes an unfunded chronically vacant position, but it also seeks board approval to keep a vacant position, physician position that's been difficult to fill as they continue recruitment efforts to fill that. And at this point, I see that we've got Director Butler here to help answer questions.
Supervisor Yeager.
Yes, maybe again a question for you, Jeff. I know that VHP had requested 16 additional FTEs to support the membership growth that we know is going to happen, but not recommended at this time. My understanding is we're sort of going to take a watch and see sort of approach and add additional staff as we move along with increased enrollment. Is that sort of your plan, or wasn't quite sure?
Well, we
when,
know
when we thought we needed to bring more people on board.
Yeah, we know that we will need to bring more people on board. However, basically we have bandwidth issues right now in terms of all the other things that we're doing with VHP, changing policies and procedures, changing the processes, expanding the IT issues. So the strategy that I wanted to use is add positions as we see the expansion occurring. Just putting more positions in right now, we would not really be able to fill them right away. So we're going to do a pay-as-you-go kind of thing.
Thank you.
Thank you. Anything else, colleagues? If not, we'll say thank you very much. And that brings us to the end of the Health and Hospital Committee area. And that will take us then to item 13, which is the Public Safety and Justice Committee. And colleagues, we have, I think, 9 or 10 speakers on this item. So my inclination would be to hear from them at this time before we do the presentation and then roll into the presentation. So why don't we ask someone to turn the lights back on. Thank you. And then we will ask that the following folks come on up in this order. If you would, please line up so we can move right through the comments. Melinda Murillo, Patsy Caballero, Oscar De La Torre, Trevor Gillis, Lisa from the District Attorney's Office, Nicole Baldacci. Come on up, folks. And Christine Clifford, and Scott Largent, and Roger Winslow. Those are the folks I've got. Melinda Murillo, forgive me if I'm...
Hi, good afternoon. My name is Melinda Murillo. I'm a legal clerk at the District Attorney's Office. I'm here today to express my support for the DA's office budget request, specifically for more support staff positions. The lack of support staff codes in our office has not only affected the staff from doing our job efficiently and in a timely manner, but it's also made an impact for the people of this county. With ever-changing laws and court policies our office must adhere to, our support staff is under pressure to perform under more stringent deadlines. Just one of many examples is in the unit is the heart of the DA's office that processes the thousands of complaints that are issued by our office every year. These clerks are under pressure from their attorneys, from law enforcement, and the court to get a large amount of their work completed by 10 a.m. We have clerks that start their day at 6 a.m. and are staying after their shift has ended to complete their assignments to be filed for the next day. Much of the work is being sent out to our Palo Alto office clerks who are also doing overtime just to avoid backlog. Santa Clara County has one of the longest judicial delays in the state, and some of these are attributable to the understaffing of paralegals, legal secretaries, and clerk positions. Please seriously consider the request and need for more paralegals, legal secretaries, and clerks as part of the DA's office 2009 budget. Thank you.
Thank you. Next speaker. Come on up.
Hello, my name is Oscar De La Torre. I am a paralegal at the DA's office, and I am here because I have concern that the proposed budget is not enough. And I'm not the only one that thinks that. In 2008, the Board of Supervisors paid for an outside agency to conduct the management audit of the DA's office. At that time, That audit recommended that the DA's office increase, speaking of paralegals alone, 25 positions. We have only increased not even half of that, 10, in the last 10 years. Yet, crime has increased. The population has increased. Then in 2017, the civil grand jury generated a report where they also recommended increase of support staff. And they also gave us a very bad report card, where we only process 40% of felony cases within 12-month period, where we have a 2.5% crime rate compared to San Mateo, who is at 8.5, and they're at 92%. Housing an inmate at Elmwood facility and the main jail totals $268 million of our budget for 2015-2016. It costs $268 a day to house them in the main jail. Well, it costs $293 per day at Elmwood. Yet the DA's budget is only $50 million for 2015. The county taxpayers are fitting the bill for inmates that could be released or be serving time in state prison where we are not paying to house them. And then as earlier we saw that we're also paying for their medical. And it's double the budget of the DA's office. Let's take care of this at the front end before we become it.
Thank you for your comments. Next speaker, welcome. Come on up.
Hello. Hello, my name is Patsy Caballero, and I work at the DA's office, and I'm here to support additional codes for the support staff and paralegals for the DA's office. I work in the juvie unit, which is at this point one paralegal until February of this year. The workload is so overwhelming, and the increase of crime between juveniles has increased over 300% from 2016 to 2017. And then in this office, from 2016, they filed 1,162 juvenile petitions and cases. 1 year later, in 2017, they filed an additional 237 cases. And I kind of did this without any help. So I've worked a lot of overtime, comp time, about 432 hours between 2017 and 2018. So you might be thinking why the work isn't distributed to other paralegals. They also have an overwhelming amount of work, as much as I do. So I'm just asking that you support that what the Jeff Rosen is asking for in the budget of 2018 and 2019.
Thank you for being here. Next speaker.
Good afternoon, I'm Lisa. I'm here to discuss the paralegals. I'm a paralegal in the district attorney's office. In 1987, in June, the district attorney hired their first paralegal. During the 1990s, they added a total of 13 more. So now we're up in the 90s to 14. In 2002, we saw the hiring freeze that froze 22 codes overall in our office. There was an audit report that was requested by then Dolores Carr, the DA, and in that report from Harvey Rose, we had 21 working paralegals at the time. They recommended that we add 25 more. At the time, we had 165 attorneys in our office. The ratio then was 8.4 attorneys to 1 paralegal. County Council approximately has 3.56 to 1 ratio. The standard ratio in 2008 was 3 to 4 to 1. In 2013, our office had approximately 173 attorneys and 29.5 paralegals. This was a gain of 8 attorneys, plus we no longer had dependency, and we brought those 11 attorneys back into the main office. This was a gain of 8.5 paralegals in the 5 years since the audit that had recommended we add 26. The numbers mean that the paralegals were still down, and we had a shortage in 2013 of 16.5 compared to that report that was done in 2008. Currently, our ratio is approximately 6.1 attorneys to 1 paralegal. We're hoping to increase the paralegals so that we have a better workload, we can better serve our community. Thank you.
Thank you for your comments. Next speaker, come on up. Welcome.
Hi, my name is Nicole Baldacchi. I'm a senior paralegal and a union steward. I'm not standing up here for the fun of it because, well, honestly, I have a ton of work on my desk that I need to be doing, like you've already heard about. I'm here to help you see the DA's office's need for additional support codes. While I'm here, thank you, Mr. Cortese, for speaking at my graduation on Saturday. Really appreciate that. And so I've been at the DA's office for 5 years now, and in that short time, I've seen a lot of change. I've seen units created where there weren't new support staff created. I've seen more attorneys hired. I've seen paralegals here on the weekends, on the nights, in the mornings, through lunches, including myself. In 2015, 2016, 2017, I personally worked almost 400 comp hours. Just this year, 2018, the calendar year alone, I've almost worked 100 comp hours, and this is all just to support our attorneys and ultimately the justice system to make sure that everything gets done. Just as an example, about a year or so ago, I was working on a torture case in the sexual assault unit. Besides preparing the evidence for discovery and helping with the trial prep and everything from the PowerPoints to the exhibits and more, I was also in constant communication with the witnesses and the torture victim himself. This was through after hours, through 6, 7, 8 o'clock at night, through lunches. We do all this to help others, and without the extra help, and we're the ones to give the victims of our community that needed help at the end of the day. We're not the ones that you see in court who are winning these cases, but we're the ones who help it get to that point. And we're just hoping to get a little extra help so we stop getting burnt out. I really appreciate your time.
Thank you for your comments. Next speaker, come on up.
Good afternoon. My name is Trevor Gillis. I am the Chief Union Steward for SEIU at the District Attorney's Office. I am here to express support for the DA's office budget, but also disappointment in the CEO's recommendation that they not add more support staff. The sheer volume of cases handled at the DA's office has increased 30% over the past 5 years, and yet the DA's office budget originally requested only a meager 4% increase in support staff positions. Just like the advent of computers increased the volume of paperwork in offices, the proliferation of body-worn cameras, smartphones, and other digital media has caused the average size and complexity of the cases that we handle at the DA's office to balloon. Despite the office's programs to go paperless and to streamline cases, the addition of this new evidence has caused the sizes of cases to grow and has not decreased the burden on paralegals, legal secretaries, and legal clerks. The CEO has not recommended the funding for additional paralegals, legal secretaries, and legal clerk positions as a part of the DA's office 2019 budget. I can't begin to express how disappointing this is for SEIU. It fails to account for the substantial cost savings the county can see by decreasing judicial delays, thereby decreasing in custody costs. I question whether the cost savings for the Department of Corrections was considered when the cost for the DA's office budget was evaluated. For the past 10 years, the DA's office has seen natural growth in casework as the population has grown. Requests for the inevitable expansion of paralegal and clerical staff numbers has been limited over the past decades as the office has tried to streamline, reorganize, and restructure. But we've hit the efficiency limit by which we can accomplish with our low support staff numbers. So we are asking the board to seriously reconsider the request and need for more paralegals, legal secretaries, and legal clerks as a part of the DA's office budget.
Thank you for your comments. Our next speakers will be Christine Clifford, Scott Largent, Roger Winslow, and Mark Murray. And could we ask you all to line up? Welcome, Ms. Clifford.
Good afternoon. I'm Christine Clifford with PACT and Silicon Valley Debug, and I'm here to address the Department of Correction budget. Over the past several years, there's been hunger strikes at our jails, and some of the areas that the detainees repeatedly point to as problematic are grievances, classification, and programs, especially for those in high security settings where programs are scarce. These were also found to be areas of need by the Blue Ribbon Commission, the Sheriff's Office, and experts studying our jails. I'm happy to see that the proposed DOC budget reflects increases in staffing to address one of these areas, classification. A detainee's assigned classification heavily impacts housing, access to programs, and out-of-cell time, and it's crucial that it be as accurate as possible. Being able to have a meaningful face-to-face interaction with classification is crucial for a detainee to understand their classification decisions. This, of course, requires adequate staffing. Initial recommendations made by experts to overhaul flaws found in our system recognize that this would require significant increases in staffing, training, and resources to ensure success. I'm here to ask that you support the full funding of these positions and that we have some method for following the placement and progress made by these officers in providing more opportunities for detainees to have meaningful classification reviews. Thank you for providing needed staffing increases in this critical area and supporting positive reform.
Thank you for your comments. Mr. Largent, you're up next.
Hi, good afternoon, everyone. Scott Largent. The order. You guys are all, I drop this off upstairs every time I'm here. I bring it, I make copies. The gentleman that came in today, Joe, that kind of had an issue going on, he had sent some emails, I believe, to James. He was having some problems, and I got to watch Big Daddy Joe step up to the plate and say, hey, bud, we need to help you. We need to get a call back, right? Then I see James over here. Same thing. You know, they go over to James. He acknowledges he's going to do something. Okay? That man might get help. Do you think so? Or will he get put on the county go-round? Will you guys just waste his time, not talk to him? And what did he say? Smiles. All he gets is smiles all the time. So when I brought this in 7 months ago, when my civil rights were being violated in front of our courthouses, why did I just get the song and dance? Why you guys give me the dog and pony show all the time? You replicated a document that was the most unconstitutional thing in the world. Do you realize that all 20,000 county employees, when they decide to go on their little walkabouts and exercise, let's say they want to FaceTime grandma, let's say they want to FaceTime a family member, or they just want to take a picture within 25 feet of the curb of our courthouse, they are violating this order. So when you're, when they're exercising and doing the right thing and walking past that courthouse, they are violating this rule. This rule states 25 feet from the curb. Okay? How is that even right? And luckily enough with this, since none of you did anything about this, our sheriff stepped to the plate and challenged our presiding judge. We need that to happen more often in our county. Our legal community, and I'm talking about the attorneys, are spoiling this whole pot here. And I just realized, while doing a little more research, that our sheriff has more power than the president in our county and can get some things done. And I just hope that this pans out because I'm being prosecuted over this. So Scott with no record, well, I won't have a record. We'll have a fun little jury trial. But please pay attention, guys. This is really bad to do to people.
Thank you. Mr. Winslow to be followed by Mr. Murray. Welcome, sir.
Good afternoon. My name is Roger Winslow. I'm the Vice President of the Deputy Sheriff's Association. Today, our association stands at 99 vacancies, or 18% vacant. In comparison to San Jose's last report, they're about 7% vacant. As a percentage, it has been incredibly difficult to both recruit, which is a nationwide issue for most, but more importantly, retention. And as this comes to budget cuts, what I find very interesting is not one single proposal from Sheriff Smith, not one single phone call from Sheriff Smith or her administration addresses any of the things we've been talking about for over 2 years now in regards to retention, in regards to the injuries, which was a report I just delivered to you 2 weeks ago, that our injury rates are off the charts. Nothing in this proposal addresses anything for the enforcement side. Ladies and gentlemen, the enforcement side is the people that actually enforces the law, that sits here in your Board of Supervisors chambers to deal with problems when they come along. It's very frustrating that the continued incompetence of Sheriff Smith shows that there's no benefit, there's no improvement to the working conditions of the men and women that we represent. In regards to one of the items that's listed in the proposed cuts for the Parks Department, the deputies are assigned there. The only counsel I would have or recommendations is the impact this is going to have on the patrol deputies who serve the unincorporated county. This being because all five of your campgrounds, which is where your problems happen in the summertime, and even some of the off times are all in unincorporated areas. So any cuts you make from parks are going to have to be offset by your unincorporated people. One last item that I'd ask the county executive and the Board of Soups to consider during your budget process is counseling services for DSA, and this also goes for the CPOA as well. That contract has not been reviewed since 1997, and we are looking for some improvements to that. We've had discussions with the Sheriff's Office and ESA over a year ago, and we've had no response. Thank you.
Thank you. And Mr. Murray, I believe you're our last speaker on this item. Please come forward.
I can only assume you've saved the best for last. My name is Mark Murray, and I proudly serve as the president of ASME Local 1587, the Probation Peace Officers Union. We recognize and appreciate your continued support of probation services. The budget augmentation before you, which includes additional deputy probation officer positions within the adult division, comes as a result of years of collaboration between my members and probation administration and our mutual goal of effectively implementing evidence-based practices in adult services. Special thanks to Deputy Chief Jermaine Hardy and Chief Laura Garnett for their leadership in this effort. I would also like to recognize County Executive Jeff Smith for his continued support of the probation department and the men and women who deliver those services. Aside from his support of the critical staffing pieces needed in adult services, he has entrusted us with an innovative community probation model. My members are eager to work more closely with our community, partners, and residents to build safer neighborhoods. We thank you for this opportunity. We look forward to working with each of your offices to identify ways we can all work together to ensure our efforts result in a safe community and a just criminal justice system. As I will be out of town during budget hearings, I would like to take this opportunity to publicly recognize Supervisor Ken Yeager for support over the past 12 years and for his advocacy of the most vulnerable in our community and for being the voice for so many who felt government was not listening or did not care. You have truly made a positive, lasting impact on our community, and we are grateful for that. Thank you.
Thank you very much. Colleagues, that's the last speaker we have on this portion of the agenda. Supervisor Wasserman, this is the Public Safety and Justice Committee section. I want to give you the opportunity to make any initial comments if you would like. If not, we'll go straight to staff.
Thank you. I do want to say how much I appreciate the men and women in the various departments of public safety and justice, the passion, the effort that they put forth in all the various areas that come under this section. I look forward to staff reports, and I do have some comments and questions to make once staff's reported. Thank you.
All right, then let me turn, is it to Mr. Eturi again to lead us through this part of the agenda? Thank you, sir. All right, Mr. Eturi, go to it.
Okay, thank you. We'll begin with an introduction of the recommended budget for the Office of the District Attorney. The recommended appropriation for the Office of the District Attorney budget is $145.3 million. This includes $1.8 million of recommended actions to add resources, to increase caseload efficiencies, to expand services to provide to sexual assault victims, to augment the County Youth Task Force and Parent Project, resources to support the Crime Laboratory, as well as resources to reduce consumer fraud and environmental crimes. And at this point, we'll see if, ask if there's any questions of the District Attorney or other staff.
And before we go to questions, let me look to the District Attorney, welcome him, ask if he has any preliminary comments before we see if there are comments or questions from members of the board.
I'll wait for comments from the board.
Supervisor Wasserman, to be followed by Supervisor Yeager.
Thank you. I wanted, through the chair, to address a question to Dr. Smith regarding the administration's recommendations regarding support for the District Attorney's Office. We heard about the paralegals. We heard all the rest. Just your thought process as far as that backup in that specific area.
The District Attorney's budget is always a challenging one for us to deal with. If you compare us to other district attorneys' offices, we have a higher percentage of attorneys to our population by a significant amount. I think if we look at that and from our county executive's model, consider some of the other functional issues that are going on, we have to be conservative, and our approach basically is that we give you what we think is a conservative, rational budget, and we're happy to take input from the board and from the DA. In terms of the paralegals, that was a question. That's a question I think you should ask the DA.
Thank you. I'll do that, and I would be interested in, as you bring back the budget revisions as we go towards finalizing this whole process. So through the chair, I will ask the DA. Mr. DA, we just heard from Dr. Smith, as you did, as far as ratio of attorneys to citizens. What I was listening with the speakers was the ratio of paralegals and support staff to attorneys. Your thoughts?
Yes, in the budget request that we made to the county executive's office, we asked for 4 paralegal positions. And while I certainly understand that we can't get everything that we want, I think it's important for the board to understand that I don't simply submit whatever sort of what my wish list is. I mean, I look through and think very carefully as to everything that I ask for, and I do think that we need additional paralegal support. It's true that the complexity of cases has grown exponentially over the last 5 to 10 years, particularly with the advent of body-worn cameras, and it would be helpful to have additional paralegal resources. I certainly, in terms of staffing for the DA's office, in terms of number of attorneys versus other counties, you know, I sort of look at those figures myself quite often, and it may be true that we have more staffing than places like Riverside or San Bernardino, but there's a reason that we live here. And the staffing ratios for the Bay Area, we are not on the high side compared to San Francisco, compared to San Mateo, Alameda, or Contra Costa County. And so I think that in terms of paralegals and support staff, I think that is an area where we have need, and we certainly could use additional resources there.
Thank you. I'll conclude my comments at this time with a comment to my peers, to the DA, to our CEO. It's, Mr. DA, your department, any department, it's the support staff. No offense to any department heads, no offense to any attorneys, no offense to anybody else, but the support staff, that word support to me is like a foundation for a building. If the building keeps growing and growing and your foundation isn't good, that building's going to crumble. And there's the face that the public sees. There's not so much in your department, but certainly in many of the other departments that we have here. I think often about the nurses in our hospitals, the nurses interacting with the patients. But in each and every department here at the county, to me, the support staff is so critical. And whether our ratio of attorneys to citizens is higher than others on the higher end or not, two differences of opinions. One thing that's important to me is that the ratio of support staff that gets the work done competently and reliably and professionally is extremely important. And I think going forward, we need to make sure that we don't grow too fast, because that's just a recipe for disaster. And fellow board members, myself, if we do approve, or as we have done, if we approved extra dollars for administrative, management, attorneys, whatever, we need to go hand in hand with that, providing funding for the support for that same administration that we support. It's they're one and the same. It really is. And this concerns me, and I'm looking forward to further discussion between now and the actual voting on the budget as far as some revisions that might be appropriate. Thank you.
Supervisor Yeager.
Thank you, and I certainly appreciate the comments made by Supervisor Wassman and agree with him on how valuable the support staff is in getting all the work done. I just maybe, Mr. Rosen, you could maybe do an off-agenda report to us before our final budget hearings on maybe a way to understand where you are on staffing with paralegals. Perhaps one way to do it is, what's the ratio between paralegals and attorneys for us and comparable counties, or benchmarking what other counties are doing, just to have some idea of where we are and be able to do this in a more sort of analytical way.
Yes, we'll be happy to get that to you within a week.
Great, thank you.
All right. Supervisor Cortese.
Thank you, President Smidian. Question regarding Parent Project. We received a presentation in the Children Senior Family Committee a few days ago with regard to the unit that I think we now call the Equity and Justice Unit. I may have that slightly wrong. It's a brand new name, but sort of the unification of several units in the county executive's office that are dealing with just about everything from disproportionality and overrepresentation in systems to women's issues and so forth. They talked about the need to create parent mentoring programs, and it sounded an awful lot like what Parent Project does. And I know a few years ago, partially at my instigation, we moved Parent Project sort of formally into your domain. That's where it started in the first place, and try to move the funding there as well. I don't know if you've had an opportunity, given the newness of what I just described, if your office has had the opportunity to check in with David Campos, Deputy County Executive, and the folks that are doing that work as we go forward in the upcoming year. I want to make sure that we don't leave short the ability for Parent Project to grow. I know you've accounted for some of that growth in your base budget request as presented by the county executive. I'm just questioning whether it'll be enough, given what we heard from them and their desire to ramp up those kind of activities out in the community from a, I don't want to say a social service standpoint, but from a safety net standpoint.
I'll certainly have a conversation with Mr. Campos and talk about how we can collaborate and increase the parent mentoring that we're doing. We certainly are very pleased with the growth of the Parent Project over the last 5 to 6 years, and the number of classes and the different languages and the locations, including the county jail where we offer classes both to men and women. But there certainly are more people that we can reach, and perhaps in conversation with Mr. Campos, we can strategize as to how we can do that. So I'm happy to do that.
Yeah, and along the lines of Supervisor Yeager's request, if there's information that's helpful between now and the budget hearings for us to get back from you in terms of any new thinking about that ramp up, the trajectory. If there's enough help here, obviously we don't want to overkill budget-wise. But it would be good to hear back, so as we adopt the budget, we know we're in good shape.
Sure, I'm happy to do that. I'll respond back on both of the subjects, one that Supervisor Yeager mentioned and the subject you mentioned as well, Supervisor Cortese.
And through the chair, I just want to say as an editorial comment, I think these are sometimes just issues of linkage. We're so big as a county that sometimes we hear, and Supervisor Chavez or Vice Chair Chavez will attest about things that are need assessments that we have heard elsewhere are programmatic services being delivered somewhere else in the county. And I just want to also make sure that's not one of these situations where just because of where the program's domiciled, it hasn't fully connected with folks that are about ready to charge off with the cavalry and start attacking this problem. So I'll close my order book now. Thank you for your response.
Thank you very much. Supervisor Chavez.
Thank you. I I'm not sure if this is a question for Dr. Smith or the DA, but I'm wondering where we are with the discussions for the funding for the SART kit changes that we're making. If that will be coming back as part of June revise, or if those discussions have already concluded.
The answer is yes. May revise.
In June revise? Thank you.
Thank you. Supervisor Cortese, your light is still on, sir. Thank you. Mr. Rosen, 2 or 3 years ago, can't remember when the budgets are starting to run together for me here. I asked a question which was born out of an overly general org chart, but the question at the time was, do we still have a governmental integrity unit in your office? And if so, how is it staffed and how's it doing? And so I'm going to ask that question again.
Sure. So the public integrity unit that we have in the DA's office, there's 2 attorneys that are assigned to that. One is John Chase and the other is Dan Kasabian. And then there's one investigator that's dedicated to that assignment, that's Lacey Highland. And then we bring in additional investigators as needed as investigations come up and we need more resources. John Chase sits 2 doors down from me. He works all the time, so there seems to be no shortage of work for him. And that's the overall funding of that particular unit. There's a lot of inquiries about Brown Act. There's always inquiries when there's an election coming up. Obviously, it's been reported that there's a lot of interest in what's happening in Alum Rock, and we've had a number of prosecutions involving correctional officers in the jail, and that's been keeping them pretty busy.
Thank you. I don't have a point of view to offer about the budgeting or funding level of that piece of your organization. I know that it is a relatively small piece, obviously, given the scope of the entire organization. But I do just want to highlight it again. And I also I want to just toss a thought your way and ask you to think about it in the year ahead, because there'll be another budget process next year. And that's whether or not the need might not be ever greater by virtue of the fact that we've seen a continuing hollowing out of the press function. And that press, the media, the popular press, mainstream media, whatever you want to call it, historically played a significant role in providing oversight of public bodies. And so if there was a local city council or school board or special districts, which get even less attention, frankly, you could count on somebody there to start asking questions from the media and to bring these issues to light. I think we're seeing less and less of that now. It's why at the state level we've got something called Cal Matters that is trying to make sure that important statewide issues don't disappear entirely from the public consciousness. But I just want to sort of plant that seed with you, do it in an open public way here today. And as to the conversation that I'm trying to start here, I'll just say to be continued. Okay.
Okay, I'll certainly look into that, Supervisors Committee, and I do agree with you that the press and particularly the media that covers local affairs is not as robust as it was 10, 15, 20 years ago. I think that's not an editorial comment. That's just
it is what it is.
It is what it is. And it is true that many of the leads and many of the investigations in the Public Integrity Unit begin because we read the local media and we read the local papers, and that's one way that we find out about things in addition to people contacting us. So let me do a little bit of thinking and strategizing and see what else might be helpful to make sure that we have the resources to keep an eye on local government.
Thanks so much. And at the risk of stating the obvious, this is my way of underlining the importance that I attach as one member of the board to this particular function. Anything else from members of the board? Anything else from your office, Mr. Rosen?
I just wanted to add, in terms of the issue of SAR kits, I'll certainly be in conversation with the county executive's office. We believe that there will be some funding to help us deal with the backlog by sending a few hundred SART kits to an outside agency to eliminate those. In terms of going forward, we are reconfiguring our resources, and we'll have at least 3 DNA analysts dedicated to looking at SART kits. The process of getting rid of the backlog, having at least three DNA analysts dedicated to SART kits will bring our average below 94 days where it is now, but I don't believe that that will get us to 30 days without some additional DNA analysts, and I'll talk more with Dr. Smith about that, but I just want to bring that to the board's attention.
Supervisor Chavez to be followed by Supervisor Wasserman to be followed by Supervisor Simidian.
So one thing is I really appreciated that the report you brought back to us demonstrated that there would be additional resources needed and that we were going to need additional staffing. And that's what I think, what I'm hoping that you and Dr. Smith get a chance to review. I think the other issue that I just want to make sure gets addressed as part of the discussion that you have is with relative to whether or not we, in addition to dealing with the backlog of known kits that we have, is also whether or not we're going to need to support an audit of all of our departments to make sure that there's nothing there either that requires attention. And so one thing I would just like is you both talk about the one-time expenditures. That one-time expenditure may need to include an additional mechanism for auditing and potentially even for doing that over a period of time. And that may be able to be done as the paralegal advocates were speaking about the administrative support needed. That may really be a broader administrative support that's going to be necessary, because I think it's going to take a while for us to work out the logistics with all of the departments and with our SART team at BMC. So that's just one point I would make. And then, so if that could be included as part of the discussion, because for whatever reason, I can't remember if that was included as part of the initial recommendation.
I know that one of the things that we had talked about in our recommendations to the Board of Supervisors was that we were speaking with all the law enforcement agencies in the county to develop a procedure by which all those SART kits would get to the crime lab within 20 days, and to make sure that that was happening. And it may be that some kind of audit is something that will help us ensure that.
I think the other part of that, I was going to say Mr. DH/Jeff, other Jeff. The other part of it that I want to make sure we stay on top of is that it will require a different approach from each of the departments, and I know that takes time for people to relearn policies and procedures. And the one thing I don't know as much about the other departments outside of the city of San Jose, but they, because of their rotation process, every 3 years people get a new assignment, and I recognize the implications of that are an ongoing level of training until that's really cemented into everybody's, frankly, into everybody's onboarding and orientation and all of that. So that's part of the reason I was interested in the audit, because I think it would give us also an external set of eyes. It's not us or the departments, but really someone else to call balls and strikes in terms of how we're moving on this process. And then the other thing I just wanted to add, I appreciate that, I appreciated the response that Dr. Smith gave relative to the paralegals, but one question I would want to raise, and I'm sure this is true for you and a number of other departments, that it appears to me that the paralegal opportunity is that at some point we're going to have a difficult time growing, continuing to grow as an organization, and I think making sure that we have the paraprofessionals that are really strong in their bodies of work and really prepared to lead requires us to think a little more judiciously both about under what terms and conditions we're hiring paraprofessionals and what our expectation will be for them in the long run. So I appreciated the issue being raised today. Thank you.
Supervisor Wasserman.
Thank you. First, I want to compliment Supervisor Chavez on her baseball analogy, throwing balls and strikes. That was good. It's basketball playoff season, but that's okay.
Nothing but net, supervisors.
There you go. Very good. Very good. Mr. Rosen, as far as the SARS kits, the processing time, what you say is picked up by the press. What we say, not being experts, is sometimes picked up by the press. The public hears what it wants to hear, reads what it wants to read. To me, it's very important, and you educated me on this about a couple of months ago. There's those attacks where the offender is known and the kits are not necessarily processed. There are those where the attacker is not known and the kits are processed as quickly as possible.
Correct.
Do I want them all to be processed in 24 hours? Sure. Do I want them to be able to do that north, south, and central county? Sure. But I would ask if you could take just a moment here today and explain for all that are here and for any press that might be listening. You talk about, for instance, the 93 days, or what the state mandate is, or what the state average is, or what other big counties are. What is our average time turning around kits where there's an urgency because it's an unknown assailant or for any other reason? Because I believe the number you quote most of the time is total kits.
Yes. So in terms of SAR kits where the perpetrator is unknown, we don't know who the perpetrator is, it's a stranger rape situation, those are kits that we turn around within 7 days, often much more quickly than that. Kits where the perpetrator is known are what we call priority 2 kits, and those kits take longer for us to process, and it depends on other aspects of the investigation. So our overall average is it's 93 or 94 days. The state law that's currently in effect suggests, it doesn't say shall, but suggests that SAR kits be tested within 120 days.
All SAR kits?
All SAR kits.
Okay.
So we're below that. However, I think the state law is going to change from suggesting that the kits are tested within 120 days to requiring that they be tested within 120 days. That's based on conversations that I've had with state legislatures, including Assemblywoman or State Senator Connie Leyva. I can't remember which house she sits in. And there should be some additional funding from the state when that becomes mandatory.
Good.
And that's funding that we would then be able to get. So I think that when for situations where we have serial rapists or unknown perpetrators, those are tested very quickly. And for cases where the perpetrator is known to us, those don't happen as quickly. We'd like those to happen more quickly, and they will happen more quickly given some of the additional budget resources that we're seeing, and also just some of the additional ways in which we're reconfiguring our staff.
Thank you. And just for the record, I'm supporting the additional funding without any reservation whatsoever in processing everything more quickly. But I think it's very important for all of us to hear where there's an unknown assailant in this heinous attack, that it's no more than 7 days.
That's correct.
Because what happened when this was discussed before and I was presenting at some service club meeting was, why are you taking 3 months to present when a person's been dead? And I had to explain that distinction. So I'd like our average to drop way down. I'm voting in favor of supporting additional resources towards this, but I think it's very important in our individual messages to distinguish between those 2 times, because one sounds really bad, one sounds pretty good, and I want to improve both.
Yeah,
Thank you very much.
I only give quotes for the newspaper. They don't let me write the stories.
Got it. Thank you. I've never experienced that. No. Thank you.
Thank you very much. I think that is the last set of comments, questions. The only comment I wanted to make on this subject was to say thanks again for working with folks out there in the community to see if we can get both North County and South County testing so that we don't have to put people through more than they've already gone through.
Yes,
okay.
absolutely.
Thank you very much. All right, we'll say thank you, and we'll turn to Mr. Ituria for the next presentation.
Okay, next we will introduce the recommended budget for the Office of the Public Defender. The recommended appropriation for the budget for the Office of the Public Defender totals $67.4 million. It includes nearly $1 million in recommended actions to add resources, to alleviate additional workload challenges, to address the state-required parole review processing and to add support to administrative services. And at this point, I see that we have our public defender here to help provide additional information and/or address questions from the board.
Comments or questions? Not quite. Hold that thought. Let me, if I remember correctly, I think I arrived back on the board just in time for the anniversary of the Gideon case. Is that ringing any bells with you at all?
Yes, sir.
And the reason I am recollecting that is because there's been some discussion at the national level about jurisdictions, other states in particular, where the overload on public defenders is so substantial that it has called into question whether or not the right to competent counsel has been compromised. So my question to you, and it will perhaps mirror somewhat some of the conversations about the district attorney's office and staffing, is how do our staffing levels in this county compare or contrast with, in terms of caseload, with other jurisdictions?
I have a memo prepared for the board, which will be coming your way probably in the next 2 weeks. I'm waiting for a final consultation with the ACLU related to caseload and workload numbers. But to answer you generally without going into a whole lot of discussion about national standards, I would say, since I became the public defender in 2012, I have asked for additional staff each year. Each year I've been given additional staff. We keep a very close eye on the number of attorneys we have as well as the number of support staff. So part of the calculation in comparing how we're doing relative to New Orleans or Baltimore is, one, how many attorneys do we have relative to our annual number of cases, but also how many paralegals and how many investigators and how many clerical staff do we have, because in places like New Orleans, the attorneys are interviewing witnesses themselves, they're entering data themselves, they are doing paralegal work on top of their legal work, making copies, doing interviews, doing intakes. So I would say we compare very favorably both to adjacent counties in California in terms of caseload relative to staffing numbers, and we really aren't even in the same kind of constellation relative to many places in the South.
Thank you. Any other comments or questions? We'll look forward to the memo.
Thank you.
Thank you. Mr. Attorney, next.
Okay, next, we'll present the recommended budget for the Office of Pretrial Services. The recommended budget for pretrial services totals $8.5 million. It includes nearly $1 million in recommended actions to add resources to enhance the electronic monitoring program, to expand the data analytics, to implement data-driven policies, to increase the re-review of defendant pretrial assessments, and to continue and expand the community accountability program.
Thank you very much. Comments or questions from members of the board? Presentation, if any, from staff?
We don't have any at this time. Thank you.
Then we'll say thank you very much. Appreciate your patience today.
Thank you.
Go forth and do good work. Next item, please, Mr. Atturia.
Yes. The next item is the budget for community justice system-wide costs and public safety realignment. This budget unit reflects support for the criminal justice system and trial court operations and accounts for system-wide resources such as the public safety sales tax and the public safety realignment revenue. The total appropriation is $49.4 million. It includes $5.6 million in recommended actions, largely aimed at the Reentry Resource Center. It includes enhancement of contracted services to serve clients, as well as some physical renovations to the resource center itself. And at this point, ask the board if they have any questions on that budget.
Supervisor Wasserman.
Thank you. No, just a compliment. The reentry center in South County was moved from San Martin to Gilroy. we're off to a very good start, very good involvement, referrals, and growing just by the week the number of people that are taking advantage of that. So thank you very much for that. Please tell Javier thank you very much as well. The program that you've opened up, created there is tremendous. And Javier is there. So Javier, just thank you very, very much. I've received a lot of feedback, a lot of positive feedback on what's going on. I'm very optimistic and hopeful that the move you made in coordination with both the chiefs of police of Morgan Hill and Gilroy and getting that done. I was at your grand opening, and I think it was a super smart move, and I think in a year or two we're going to start to collect numbers that show the results of the crimes that your efforts have prohibited from occurring, and which of course means fewer victims in South County. So thank you very much for that.
Thank you.
Anything else? If not, we'll say thank you very much and go on to the next item.
Okay. The next budget presents the recommended budget for the Office of the Sheriff. The recommended budget for the Sheriff's Office totals to $185 million. It includes the addition of resources to increase the number of body-worn cameras, to resources to ensure compliance with the California Department of Justice policies. It also recommends the decrease in the number of patrol support in the county parks, and it deletes chronically vacant positions. And at this point, I see Sheriff Smith and is here to help provide additional information and or assist with questions from the board.
Thank you very much. Sheriff, welcome. Chief, welcome. Anybody want to offer initial comments, or would you like us to go straight to the board?
To questions is fine.
Thank you very much. Board colleagues? Got just a couple. One is, I'm curious at what's going on with the reduction in support dedicated to the parks. And I noticed that in the budget, page 310, it says the Sheriff's Office Patrol support to the Parks Department will be reduced from 11 full-time equivalent positions to 6 full-time equivalent positions, resulting in a savings to the Park Charter Fund that will fund parks positions and future capital projects, and then remaining sheriff's deputies will continue to support the department with more serious incidents. So just the first question has to do with sort of how we're going to provide whatever level of safety protection that we need, and I gather there's a move to use some park staff rather than sheriff's department staff. Is that what's happening?
I think I should probably jump in there because this was county executive recommendation, not the sheriff's recommendation. And basically the history is that during the down times in the economy, when there was cutting going on, the idea came up from the county executive's office to save deputy positions by putting them within the park charter fund so that you could spend park charter on deputy positions. Now that we are not in that kind of position, the recommendation is to revert back to a model where the deputies are placed back in the sheriff's budget, and they would be supported by general fund, and we can utilize the park rangers, which we already have, and surrounding police departments to respond to any issues within the parks, which is standard operating procedure for basically all big park systems. I don't think the sheriff supports the idea, judging from the fact that she certainly ran out and filled these positions with staff so that it makes it more difficult to do that, but still stands as our recommendation from the county executive, and so she'll give you a different answer.
Well, here's part of the
I did notice it, Sheriff. Thank you very much.
Part of the reason for the question, and I was just struck by this, is, and you know, it's the small print, but it says the decrease in salaries and benefits would therefore be $876,155. And again, I'm on page 310 of our budget document. So the decrease in salaries and benefits by virtue of these positions being deleted, $876,155. But then it says decrease in reimbursement from parks, $1,400,000, which I read, unless I'm missing this, and maybe Mr. Iteria can help me. Yeah. I read that as that parks used to be paying $1,400,000 for $876,000 worth of services, and I'm just trying to figure out how that happened.
Yeah, through the president, the difference is the overhead factor. So also charging a share of the sheriff's overhead related to those positions because they require supervision, some degree of housing for administrative support, et cetera. So that's the factor, the difference.
We should also point out,
if I could ask you to hold for just a minute while I follow up with Mr. Iteria, Dr. Smith. It says salaries and benefits, so it's not benefits, it's administrative overhead, and we're talking about $524,000 worth of overhead on $876,000 worth of salaries and benefits?
Yes, that's we can double check with the finance staff from the sheriff's office, but my understanding that was the overhead calculation for that as well.
Again, $524,000 overhead for 5 FTEs. Dr. Smith, I did not want to preclude your comments. I just want to make sure I was following Mr. Iteria. Thank you for
yes, I understand. I'm sorry that I interrupted.
No.
I should also point out that, the benefit amounts ratios for badge personnel are significantly higher than civilian personnel, such as park rangers. So it is a big hit for the Parks Charter Fund, and we were trying to make a recommendation that would preserve park charter funds because we know that we're having problems with that, and not eliminate deputies because there's obviously, as you know, a lot of vacant positions in the deputy staff, so that we can certainly support those from the general fund. We're not talking about reducing personnel. We're just talking about relocating personnel into the general fund supported Sheriff's Department rather than in the Park Charter Fund.
Thank you. Sheriff, anything from you or your team you want to share with us on this subject?
I would never contradict the county executive, but he is correct in that I don't support these cuts.
Okay. I think what I would like to do, Mr. Ituria, is ask that my office follow up with you on the $524,000 overhead allocation. I heard what Dr. Smith said about the public safety benefits and salaries, but again, I'm looking at the number that says salaries and benefits, which is that $876,000 number, and just am struck by the fact that $524,000 overhead, which is a 60% overhead factor, seems hard for me to fathom, and I'd like to fathom it. So we'll follow up offline. Don't need to take more time with the board today. And then the next question I have for the Sheriff's Office is if we could have a conversation about that 18% vacancy rate that that I think was referenced earlier, but we recently saw in the chart we received from Mr. Mills, which was countywide, and your thoughts about how you're faring in that regard.
So I'm basically, the way I've just now calculated it is that we have 47 vacancies in enforcement, minus 5 that were cut from parks, so that's to 42, and we have 25 in the academy now. To me, that looks like 17 vacancies only. Yeah, and that's just enforcement deputies. For the correctional deputies, we have a vacancy of 13. Those are very, very low numbers.
Yeah, the 47 is not the number that I remember from Mr. Mills's handout. I don't happen to have that handy. Does somebody have a copy? Thank you. this is the handout dated May 18th, 2018, and under Sheriff's Office, which is distinct and separate from the Sheriff DOC contract, which is a separate item, where there's a much lower vacancy rate, to your point, Sheriff. But on Sheriff's Office, it shows 143 vacancies out of 802 number of positions with an 18% vacancy rate. So at the risk of stating the obvious without knowing the answer to these questions, 143 is a very different number than 47.
47 minus everything I minused, making it 17. Correct. Our numbers are as of May 6th, and we have the personnel captain here and the training captain here, and I just got those numbers from them.
Well, I don't need to, particularly without Mr. Mills here and without access to the back and forth on it, but I think what might be helpful is, Dr. Smith, could we ask that we get some reconciliation between the two different numbers, because they're pretty different numbers.
Yes.
Yes,
okay.
we're planning on the numbers that you have from ESA are the vacant funded positions in each department. There are some reasons why some of them are vacant and funded. So we're coming back with all that information, and we will certainly make sure that we do a careful one-by-one walkthrough to make sure that the numbers for the Sheriff's Department are correct.
Well, let me ask this. Is it reasonable to ask for this, I'll call it a reconciliation in the next 2 weeks?
Oh, sure.
Okay, if we could ask for that as an off-agenda report, because, and, I understand sometimes we're comparing apples to oranges, if such a analogy can be used for numeric functions, but maybe it's base 2 and base 10, I don't know. But I do think the starting point is to understand what the numbers are, and as I say, big difference between 47 minus to the Sheriff's point and 143, and understanding the nature and extent of the vacancy problem. I have no other questions at this time. Supervisor Chavez, I see you leaning in.
Thank you. Just on this point, I also recognize that, and this may not be the only department, Greg, that this is the case, that having people who are in some part of the process of being hired is also an important thing to understand. That's partly why I asked the question about the, who were we actively recruiting for and who weren't we? So, if being in in class, in an academy counts as somebody being in or not, would be really helpful to understand. And then just one last question I'm glad you raised this topic on the, for us to be able to take a look at the unfunded non-recruiting or whatever that. No, when Dr. Smith was just making the comment about how there are some positions that may be funded that we're not recruiting for because they may also be in the process of being eliminated, even if they aren't eliminated today, that you all are doing an assessment, that would also be really helpful to understand because, well, anyway, for obvious reasons. Thank you.
Any other comments or questions on this item? I see none. Sheriff, anything else from you or your team? All right, then we'll say thank you very much for being here today. And Mr. Iteria, we're on to the next item.
Okay, the next item is the Department of Correction, and the recommended budget, recommended appropriation for the Department of Correction is $265.6 million. It includes $3.9 million in recommended actions to add resources to address jail reform efforts related to inmate movement and transportation for healthcare appointments, classification, and the 60-day reviews on inmates' housing, as well as the needs of mentally ill inmates.
All right. Board members, comments or questions? Supervisor Chavez.
Thank you. And I'm not sure who this is a question for, so I apologize for that. There are two items that the board has taken formal action on that I cannot find in the budget, but they're relatively small, so you may need to tell me where I can locate them or if they're where they are in process. One is a gender responsive consultant to review the Department of Corrections programs and other initiatives. And I think the cost of that was 150,000 or so. So if you can help me find out where that is in process. And the second was the jail staffing study. And again, both actions were taken by the board, so I'm not sure if there's another action that needs, another, or if they're in here, and how much are they, and where would I find them?
They're not specifically called out because they would come out of Object 2, and so we have Object 2 allocated basically in a, I won't
Because they're
say lump
consulting
sum,
contracts?
but there's a specific, so they would come out of Object 2. So we didn't specifically call them out, but there's sufficient funding there in Object 2 to pay for them.
Great. And then if I could, on those two initiatives, if there's already funding, if I could ask for an off agenda, just a report on just where we are in the process for both of them.
Sure.
Thank you.
All right. Anything else on this item? Sheriff, anything else from you or your team? Chief? All right. Thank you very much. On to the next item.
Okay. The next item for presentation is the recommended budget for the probation department. The recommended appropriation for the probation department is $185.4 million. It includes recommended actions totaling $1.7 million. These will add resources to mitigate caseload assignment in the adult supervision unit, enhance operational and administrative services. The actions also establish a community-based program unit and implement a community-based violence protection model. Chief Garnett and staff are here to assist with additional information and or questions from the board.
Welcome, Chief. Welcome to your team. Board members, comments or questions? Chief, any comments for our board's consideration? Forgive me, Ken.
Yeah, I was just a little slow on that. Thank you for the great work that you're doing in the community, and very excited about the community-based program unit, and glad that those were funded. When do you anticipate the new community program unit to be up and running? I'm excited to know and to learn more about it, and know what impact it's going to be having in the community.
Supervisor, are you talking about the community-based probation officers or the expansion of the neighborhood safety unit? I think you're talking about the community-based probation.
Yes, the ones that have been added to the budget this year.
Yeah, it's very, very exciting. So we're already planning. We're going to put 2 people in immediately and leave other vacancies so that we can get started. We have a lot of great ideas. We're definitely going to start a diversion program with San Jose PD. They don't have an in-house diversion program. Most agencies do. And additionally, we're going to partner with the neighborhood safety unit and with at least Gilroy PD and San Jose PD, because those have been our biggest areas where we've had upticks. So all kinds of great things. It's going to have a restorative justice focus, meeting the merchants, getting just embedded in the communities. It's going to be great.
Do you want to mention anything about the relationship with San Jose PD, and if this is one program that is going to sort of work with them more collaboratively rather than sort of any criticism, shall we say, that's come in the past?
Yeah, sure. I think there were some misunderstandings about our data and just about kind of operationally how our system works. We've come a long way about educating certainly the upper echelon and then the line staff as well. Our intake staff had been working with them. They had a lot of new officers on the street, so there was some issues with reports and that type of thing. Some issues with just some misunderstandings about some of our policies. So we've gone through all of those. They've toured our juvenile hall and the ranch extensively. We spent a good half a day doing that, which was great. I would say the relationship now is really good. I think it's certainly as good as it can be. There's inherent tensions, obviously, but I think it is really good. I think the diversion program, especially with San Jose PD, is going to go a long way, probably further than they even know. Because I think just having, all the research says it's the amount of the proximity of the intervention to the behavior, not so much what the intervention is. So, you can take somebody's phone away for an hour and it can be way more effective than doing something else 3 or 4 weeks later. So I think for the officers on the street, that's going to be huge to be able to say, hey, this kid, just stole a candy bar and ran out of 7-Eleven and it's the 10th time or whatever, and we'll be able to address that right then.
Thank you.
Supervisor Cortese.
Thank you, President Smitty. On the same subject, it's SJPD for many years, up until they went through their dramatic loss of personnel, losing 500 officers, had one of the top crime prevention units in the country that did, it sounds like, much of the same work they're now asking probation to come in and help out with this unit or these particular employees. They and you can disagree with that if I'm off base, because I'm premising my next question on that. But let me tell you what the next question is. The crime prevention unit was mostly deployed on school sites or in conjunction with school liaisons, school safety directors, gang prevention task force, so that in effect they were doing early intervention and sometimes just prevention. If they knew, for example, something happened in a park last weekend, maybe it was violent activity, maybe it was gang activity, and they suspected it might spill over into a school site, and then you could start dealing with that. And of course, with all the school safety issues we've seen regarding firearms across the country, one can only wonder how vulnerable we might be in the schools with San Jose having completely cut, that unit out of their program altogether. So I'm glad, on the one hand, that they're asking somebody for help because they can't do it themselves. They've created this situation. On the other hand, I'm not clear, given the limited resources we have, it sounds like you want to focus them in the neighborhood safety unit, which I like because I'm so closely tied to the neighborhood safety unit. But what's your response to this larger need that's really gone unchecked or unsatisfied now for a number of years with regard to the loss of their crime prevention unit in the schools?
The school issue, so I'm not really sure about the loss of the crime prevention unit. I think that predated me.
Well, let's just say, for the sake of conversation, I'm willing to guarantee you that it was cut and it went away completely. But given that, maybe I should be asking you, how much of a problem is that, and how much can we do with this unit that is in the budget here in probation?
I think one of the exciting things is we don't know what we can do because we've never had something that we could grow organically. I think Mr. Murray spoke pretty eloquently about how they've rolled up their sleeves. Our probation officers have done just a stellar job of immersing themselves in evidence-based practices and getting out in the community and trying to be more visible in the community. So while I see this as a assistance to San Jose PD, certainly, I think what we learned, huge lessons learned kind of when the controversy and some misinformation got out publicly, is nobody really knows what we do, except for like maybe you guys, but very, very few people. I mean, they're like, oh, you're not with the sheriff's office? Oh, you're not with social services? And so it's, we can be doing a lot more. We can be doing a whole lot more, and I'm not evading the question. I think we need to develop it. I think we need to build it and see what comes of it.
And through the chair, I just want to follow up. In my first opportunity to serve as board president, we were leading right up to that point. We had been dealing with a lot of community pressure to break up the probation department into two completely separate units, an adult and a juvenile. And upon a lot of study and even looking at models where that had been done, like San Francisco, we came to, despite the fact that in my first day of the county I said we should do that, really kind of walked that back and learned, after learning that wasn't correct. But what is correct is to have, for this kind of work, this youth work particularly, to have social service-oriented probation officers who are a little less about a badge and a gun when they're in a community and a lot more about what we call diversion, without trying to describe that right now. How will these folks look? I mean, this unit, is that, will they be consistent with that philosophy, this philosophy that we're not here to, we're not here to enforce, we're here to intervene?
Absolutely. So the agreements going in are these will not be armed positions, period. They'll be dressed in regular street clothes. I'm not saying that they're not going to contribute to some intelligence gathering by any of the police agencies, but we already do that, so it may just be more convenient. And we do actually a fair amount of that, looking at video and identifying people. But otherwise, they're going to be very, they're going to be community-based, and they're going to look like Mark Murray looks today. And that's really, really the purpose. And I will tell you, since...
Gee, that was...
I wasn't going to say that.
That was mean.
Moving right along.
Since I came right at the time that the discussion was happening between the adult and juvenile sides of probation, I have to tell you, I really like the model where they're integrated. I don't really particularly care for the San Francisco model for a variety of reasons. But what this has done is there's been a lot of, not cross-pollination, but because our staff moved between units and adults, yes, we have some really high-risk people, and they also need to be treated the exact same way that we treat our juveniles in the community. And so the expectation is that all of our officers are behaving in very similar ways, and that will be the expectation, and they will not be armed.
Well, in a final comment, I'm, for one, pleased that we're, in a sense, moving people out into the field. I don't know if that's exactly an accurate statement, but to the extent that we reduce numbers, incarceration numbers, and particularly with our youth, and essentially try to put juvenile hall out of business in the sense that we don't need incarceration facilities for 300 or 400 kids anymore. I think it was the idea all along that would allow us to move personnel out into the field in sort of in the chain of intervention or in the stream of it to do their work a lot earlier in the process, without costing people their jobs or without making us feel like we didn't need them anymore. So I like all that. I'm a little suspect about how much we can do to backfill San Jose's needs, given the dramatic hole that they've created for themselves over there. But I guess it's worth a try, and we can talk about it over the course of the year and see how it's working. Thank you, Mr. President.
Thank you. Other comments or questions? Supervisor Chavez.
Thank you. I wanted to just say how much I appreciate the probation department, and you're working with, with everybody, even when they're giving critique and feedback. And so I think that's really good. I got a chance to participate in the tours of the ranch and our juvenile hall with San Jose PD and all of you. And one of the things I was struck by was a recommendation by some of your staff that we look at being able to allow animals to be used for therapeutic reasons on both of those campuses. My understanding is that it would just require an ordinance change from us and may require future budget action. But I wanted to just ask Dr. Smith what your thoughts are on moving in that direction.
Well, certainly there's pretty well established evidence that therapeutic animals of all types help with recovery. Large animals like horses, dogs, chickens, whatever. Chickens aren't large animals.
Not so much chickens.
We wouldn't have a problem from a budget perspective. From ordinance perspective, I'll turf that to county council.
Okay. When the going gets tough, we go to the county council. So
yeah, we would just need a ordinance code amendment. There's currently a pretty broad prohibition on animals in county facilities, except for service animals and for facilities that are designated, facilities that are specifically for the care or detention of animals, like our animal shelter. But that would not be very hard to do, but we could make that modification. But it would need an ordinance code amendment.
So would you need a referral, or is that something you can just start working?
We can work with administration on that and bring it forward if it's an item that administration wants to bring forward.
Yes, we'd have to come up with a strategy for staff support and, a number of processes and procedures. We talk with our animal control individuals. Maybe we could bring some animals from the shelter up, start maybe with the pilot and move on to a bigger phase.
Supervisor Chavez, would an off-agenda report on how you might proceed help move things along?
That would be great. Thank you.
That work for staff? Great. All right. And Supervisor Cortese, you're good to go? Thank you. Anything else on this item?
I would just like to thank the board and Dr. Jeff and your staff for this budget cycle and for looking at this. Thank you.
Thank you all very much. Mr. Ituria, I think that takes us to item 13H. I believe this is the last item on our agenda. It is the medical examiner and coroner. Please proceed.
It is. The recommended appropriation for the medical examiner coroner is $6.7 million. It includes funding to replace a vehicle that is used for investigations, otherwise funding to maintain current level of services. And at this point, invite questions of the board.
Thank you very much. Board members, are there any comments or questions? Supervisor Wasserman.
Good afternoon, Dr. Jordan.
Good afternoon.
Question, please, to help understand. I know there was the $52,000 for the contracted grief counseling. I believe, if I recall, administration's recommendation for the vehicle, that was correct. And the vehicle in question, again, I understand the reason you asked for it. I hope you don't need it often. I assume there'll be other uses and times that it'll likely be used while we've got it. The grief counseling, I was surprised to basically learn or understand that there wasn't some other service within the county that provided that during such a time of loss when your department would be involved.
Yes, I can elaborate on that further. So our request from the medical examiner coroner's office was very specific for a grief counselor. We were seeking an individual that had extensive training or would potentially have extensive training in acute and chronic situational trauma as well as vicarious trauma. So this would be a very unique position in the fact that this grief counselor would respond as a first responder alongside the medical examiner in any type of mass casualty event, and also be available to offer potential services to employees.
So it's more of an on-call as needed as compared to an FTE? Or perhaps I asked that of Dr. Smith. I'm not sure through the chair, where to direct that question.
Dr. Smith, you want to help guide us?
I understand $52,000 wouldn't pay for it,
right.
Any FTE.
We didn't recommend it in the sense that, as Dr. Jordan said, we're talking about a very unique position. It's not a bad idea, it's a great idea, but we felt that we needed to ripen the fruit a little bit more before we picked it. So we'll have to work with Dr. Jordan to figure out exactly what kind of person, if we can find that kind of person, maybe under contract, or, figure out how we proceed. We didn't want to put something in the budget that we weren't sure we could actually implement. So It's not that it's a bad idea or that we don't want to do it. We just think we need a little bit more time.
All right. Well, given that you suggested it, given that you think it's a good idea as well, I certainly thought it was a good idea. And if there is a way to have somebody on call, not creating another FTE, not doing that, and you pay for the service as needed, I'd be interested if you can keep an eye on this and make it happen in some way.
Yeah.
Whether that's through the revise or something separate through some other means. I too think it's a good idea to have available during that catastrophic traumatic time that her office is called to duty.
Right.
Thank you.
It won't come through the revise. We need some further time on it. If we're going to hire the person, we'd have to create a new classification and, you know, have a job description. If we're going to do it by contract, we'd have to do an RFP, so we'll proceed in that manner.
Okay, I certainly like the RFP doing that and finding someone, because they could be needed a lot, they could be needed not at all.
Right.
But I think the idea of, I'll just say on call, I don't know the medical term, but having an appropriately trained professional on call as needed is something I think is a great service. Again, I was surprised that we didn't, through some other entity within the county, have such an individual psychiatry-wise that was available to provide similar service.
Well, we have our behavioral health system, but nobody in that system is trained in the kind of skills that Dr. Jordan's talking about, which really is a different kind of, you know, service.
Okay. Well, thank you for keeping it on your radar.
Okay.
I was also just informed that the Bill Wilson Center does provide services to employees during a mass casualty. I know behavioral health also has a crisis team that's available, but the position that we would be interested in would go beyond that to also provide potential vicarious trauma to employees as well.
Thank you, colleagues. Dr. Jordan, I have just a couple quick questions about budget and staffing. If I am reading the budget document correctly at pages 334 and 335, and Mr. Arturia, you may want to help me here as well. Again, these are pages 334 and 335. Number of positions is 27. Do I have that right?
That is correct.
And is that an increase or a decrease or a same number from last year?
Yeah, that's the same number.
Okay. Looking at the top of the page, page 334, salary and benefits, I believe the increase amount is $501,361, which is a 9.9% increase. Is that correct?
Yes, correct.
Okay. So is it accurate then if I divide $501,361 by 27 people and get an increased salary and benefits for the same number of people of $18,500 per employee? Actually a little more than that, but rounding off.
Yeah, sounds right.
Could I ask what that reflects?
Yeah, we can get that in our report to you. Yeah.
Okay.
We'll have to see what the year-over-year increases is. Okay. It could be anything from benefit cost increases towards the various benefits, or if there were any other type of adjustments to compensation or salary during the year. We'll have to get the detail and get that to you.
Okay, how quickly could we get that? I just want to make sure these aren't last-minute issues, quote unquote, when we actually get to the budget itself, which is coming up in a few weeks.
Yeah, we'll get started on that tomorrow, and obviously get the information well before the budget hearings.
Great, thank you. And Dr. Jordan, obviously anything you can do to help clarify that, I would appreciate it as well. All right, thank you. Any other comments or questions from our board on this item? If not, then we'll say thank you to you, Doctor, and we'll say thank you to you, Mr. Arturia. I think that's it for our agenda today, yes?
Yes.
All right, well then, without objection, and there is none, we will recess to tomorrow afternoon, Wednesday, May 23rd at 1:30 p.m. in the Board of Supervisors chambers for the continuation of our budget workshops. Thank you all very much. Appreciate your help today.